Hi, Sheila. I just heard you over the speaker. I
Hi, may
think.
I request to share?
Are you also in the room?
Yes. Yes.
Wait a minute. If you wanted to share your presentation, go right ahead. I think you also have an echo going on as well, so you might need to turn off the speaker.
Thank you.
Thank you.
Good afternoon, everyone, and welcome to Children, Seniors, and Family Committee. This is January 23rd, and we're a little past 1:30, and I'm going to call the meeting to order. I'm Sylvia Arenas, District 1 County Board of Supervisor, and it's my honor to serve you this year as chair. And I'd also like to welcome my co-chair, my vice chair, Supervisor Young. So we're going to establish a quorum by calling roll.
Vice Chairperson Young
Here.
and Chairperson Arenas.
I'm here too.
We have a quorum. Thank you.
Wonderful. Thank you, Colin. All right, we're going to move on to item number 2, which is taking public comment. This is reserved for persons desiring to address the committee on any matter that's not listed on today's agenda. So if you're here in person, please share your public comment by filling in that yellow card. If you are virtually, please raise your virtual hand to speak on any matter not listed on today's agenda. And we're going to begin with in-person public comment and then move on to our online comments. Can you please let us know, Colin, if there's anybody?
There are no requests to speak in the room. We do have one request to speak online.
Perfect. Thank you.
Our next speaker is Ben Z. You'll have 3 minutes to speak. Timer will start when you begin speaking.
Yes, hello, good afternoon. I've addressed this committee several times already about my kids who are being sexually abused. And look, my son, he's already confirmed that my ex-wife was letting somebody rape him. There are other indications of other children being sexually abused. I'm not going to go through them right now. But look, it shouldn't it shouldn't feel like an act of Congress just to get a screening for my kids. I mean, there's something definitely wrong here. And it really starts with Daniel Little, right? During his tenure as head of DFCS, 2 children passed away, right? And not only that, but it was during his tenure that I first started complaining about the sexual abuse of my kids. I'm not the only one to be complaining about him. There have been several Board of Supervisor meetings where people who work for DFCS, our social workers, are saying that he has failed our children, his policies are failing our children. And I mean, these are people calling for the termination of his employment. The people who work for him. I mean, don't listen to me. Don't listen to Violet Brooks. Don't listen to Catherine Campbell. Don't listen to Daya Baran. Don't even listen to Jordan Walker's grandfather who's suing the county. Listen to the social workers. It should not take an act of Congress to get a simple screening. My kids are being sexually molested. And this guy up here sitting, I think he's sitting up there. I can't see in my phone. But he's so callous. He has no conscience to sit here for another second and not get a screening for my children. There's something terribly wrong here. We need to replace him. And also Wendy Kinnear Roush. How many meetings have I been to? How many emails have I sent her? And she just says, the only response I ever get is, hey, if you want to file a complaint, go ahead and file a complaint. What kind of a response is that? It really isn't a wonder why so many kids are being abused in this county when we have these 2 terrible employees who are endangering our children. Please, let's terminate their employment. Let's start fresh with people who care about children. Thank you for your time.
And that concludes our request to speak.
Thank you. And before we move forward with our consent calendar, I'd just like to make a special announcement. I'd like to welcome new faces. Obviously, I've already welcomed and honored to serve as Vice Chair Young. And aside from her, we also have a couple of other faces that are new, and it's Eileen. Okay, you're going to have to help me with that. Ilona Begolia Javargis. See? Okay, can you say the whole name? Okay, we're gonna have to spell that one out for me in the way that I can honor your name, Elona. Say it again. Elona. Elona. Okay. And then she is director of the Department of Employment and Benefits and Services. And then we have Vanessa Merlano, who's our acting director, Department of Aging and Adult Services, as well as Wendy Kinnear Roche, acting director, Department of Family and Children's Services. So welcome everyone, and throughout today's meeting, I really like to welcome your participation and discussions. There'll be times when members of the committee will ask you to weigh in and offer your perspective on matters that are interrelated to programs and services, obviously, that are under your purview. Or that have been under your purview, really. And I also want to invite you to share your lens and expertise where you can. Please feel free to offer comments through the chair. My hope is that we can find opportunities to collaborate and integrate programs and resources for the benefit of children and families. So with that, I'd love to just move on to our regular agenda. Okay, we are going to actually go to item 3, which is approving our consent calendar and see if there's any changes to our committee agenda. I'm going to look to my vice chair to see. Currently, we have items 13 to 19.
No changes coming from me.
Perfect. And so I'd love a motion, and I will second.
Motion to approve the consent calendar?
And second.
There are no requests to speak online, and there are no requests to speak in the room. Vice Chairperson Young
Yes.
and Chairperson Reynes.
Yes.
Motion carries.
Thank you, Colin. So we are going to now really move on to our regular agenda. This is beginning with item 4. This is to receive a report from the Office of Budget and Analysis and the Office of Children and Families policy relating to the fiscal year 2024 to 2025 children's budget. Welcome.
Good afternoon, Chair Reynes and Vice Chair Young. My name is Sarah Duffy. I am the Deputy Director of the Social Services Agency and also acting Director of, or Chief Children's Officer, overseeing the Office of Children and Families Policy. And I'm very grateful to be joined here today by 2 of the leads on the children's budget and the pilot to collect additional data as part of the children's budget, and that is Karina Alvarez, who's in the staff seating area. She's from the Office of Children and Families Policy, and Bianca Jones from the Office of Budget and Analysis. So what we're going to do today is Bianca's going to lead us through the portion of the presentation that was developed by OBA, and then I will take over for the second half and talk in more detail about the pilot. So Bianca, do you want to take it from here?
How's that? Okay. Good afternoon. So can I have the next slide, please? So this year's budget reflects the budget for children and youth related programs as adopted by the Board of Supervisors on June 13th, when the entire countywide adopted budget was approved. It details the fiscal resources that the county has invested to ensure that all children in this county have the supports needed to be safe, healthy, and successful. Next slide. So despite a structural deficit last year that was quite significant, over $250 million, the total county spending towards children, youth, and families grew by approximately 9.1%. Most of that was due to inflationary factors such as just growing cost of supplies, rising cost of service, and then staff compensation. Next slide. And as is illustrated in that past slide, this year the county will spend approximately $1.29 billion on children, youth, and family programs, with $1.03 billion of that coming from either federal, state, or other funding streams. Next slide. One of the things we wanted to highlight, and we do this every year, is various departments and programs that really are doing great work throughout the county for children and their families. And so this year's selection as a department was the Office of Supportive Housing. Two of the larger investments within that department are Amigos Motel Shelter Program, where the total investment's close to about $12.6 million, and then the Rapid Rehousing Program, which totals to about $7.9 million. From a programmatic standpoint, we also wanted to feature the Office of Gender-Based Violence Prevention, and this program also is doing great work to really help ensure transitions and support for families and children experiencing trauma. So we also highlighted the Advocacy Flexible Support Services. Again, that allocation was about $6 million, and then the therapeutic services of close to $1 million. And with that, I will point back to Sarah to finish the presentation. Thank you.
Thank you. Next slide, Karina. Okay, so with this, I'm going to talk a little bit about our children's budget pilot for program data. And just for context, the Office of Children and Families Policy and OBA have been presenting quarterly at the FGOC committee, and will present next in March. So we've been regularly providing updates at the request of that committee on a project to gather more detailed programmatic and service data as part of the children's budget. And really the purpose of this, which we hope will be quite useful to county agencies and departments, is to create a centralized internal resource with county investments that will allow us to really understand as a county where we might have funding gaps, redundancies, and help inform future policies. And so we're hoping that through this updated data collection process, counties will have access to additional information on our current investments in children and families, such as more detail on program types, program focus areas, populations served, and contractors. So departments are in the process of providing additional detailed information on all programs and contracts that are currently in the children's budget. Next slide. Okay, so this slide actually shows us which data is collected in the current children's budget and the additional data collected. I won't read through what's already in the children's budget, which is available online, and hopefully many of you are familiar with, but the additional data that we're working on collecting include program type, program focus area, language information, age groups, clients with disabilities, race ethnicity groups, priority populations for programs, contracts information, funding source organization, and description. So as you can tell, this is a considerable amount of additional information. Next slide, please. And here you can see we've piloted this data collection tool. It was designed in partnership with the Division of Equity and Social Justice to make sure we're doing a really comprehensive job on identifying the population categories in alignment with county data collection methods. You can see within the Division of Equity and Social Justice, which are a set of offices within the county executive, that we asked for those offices to identify the areas of program focus, and this is a sample of the type of data that we will be collecting countywide from all different agencies. And so you can see here that some of the most commonly funded programs includes those that focus on social skills and life skills, immigrant services, leadership development, and behavioral health. Next slide, please. And here's another sample of priority populations served by programs which are funded through the Division of Equity and Social Justice. Those include programs for LGBTQIA individuals, women and girls, persons experiencing unstable housing, for example. And so we'll be asking for all departments to complete this type of information through the enhanced data collection process, which we think will give us a much better picture of priority populations served throughout the county. Next slide, please. So as next steps, we've done this data collection pilot with the Division of Equity and Social Justice, as well as with the Social Services Agency. We are rolling it out to all departments this year, and we are also collaborating with the Learning Organization to develop summary level dashboards with the findings from the pilot, And we anticipate having those dashboards ready in the next month or two, and hopefully demoing those at FGOC in March. And then we will be doing the more comprehensive programmatic data collection as part of the fiscal year 25-26 children's budget instructions, which will be released in the spring. So with that, I will conclude the presentation, and we're available to answer any questions.
Wonderful, thank you so much. All right, so I'm going to check for community input. Colin.
We have no request in the room. We do have one request to speak online. Next speaker is Ben Z. You will have 2 minutes to speak. The timer will start when you begin speaking.
Yes, I mean, thank you so much for the presentation. I mean, it seems clear to me that the budget is being mismanaged. I mean, how else can you explain $1.29 billion budget and I can't even get a simple screening for my children, right? I mean, let's talk about Sarah Duffy. I mean, how many emails, Sarah Duffy, have I sent you? How many meetings were you present at that I've spoken at? And not once have you responded to me. I mean, like, you must be making a six-figure salary, right? 300, 400, I'm not sure. You can't even respond to me? Would it be a favor for you to get my kids a screening? Is that what it would be? I don't understand how you come here.
Sir, I'm going to interrupt your comments so that you can keep them in general and not address one in particular, but address the board members, which is Vice Chair Young and myself. You can go ahead and conclude your comments. You have a minute.
Supervisor Arenas, does it make any sense that I cannot get a single response from Sarah Duffy? I mean, she was the chief children's officer when I first started contacting her, begging and begging and begging for screening for my children. And it's in the budget that she receive a salary for taking my emails. It's really an atrocity that it needs to feel like people are doing me a favor for getting my kids a screening. It makes perfect sense. We had 3 deaths. Jordan Walker, baby Phoenix, and the other child who was bludgeoned to death and put into a dumpster. I mean, how many more children need to die for us to use our budget correctly? I mean, please, Supervisor Arenas, take this into consideration. Thank you for your time.
That concludes our request to speak.
Thank you. Gosh, turn myself off. I'm going to ask my vice chair if she has any questions.
Just want to thank Sarah, Karina, and Bianca for the presentation. Putting together the presentation and presenting to us. I understand that the quarterly reports for this item will be heard in FGOC, so I look forward to seeing the expanded data collection points. Will that be ready for the March FGOC meeting?
So the expanded, what will be presented at the March FGOC is actually a dashboard, which will have the data that was collected from the Division of Equity and Social Justice, and I believe also Social Services Agency. No, that will come later. Just Division of Equity and Social Justice, and that's to demo that. And then we will, as we collect the data from countywide departments, we'll use that template, and that data collection will happen through the upcoming budget process. So I think we'll have a much more expanded presentation of data. I would anticipate once the next children's budget is released next fall.
Yeah, and thank you for that, Sarah. And I want to echo the discussion at CSFC in the past, that looking forward to including data points related to our investments made with or in the County Office of Education, First Five, and the Health Trust. Yeah, and so look forward to seeing the next update at FGOC. Thank you.
Wonderful. Okay, so I have a couple of questions. So programmatic, this pilot is, correct me if I'm wrong, the board had provided some direction in terms of programmatic budgeting in, well, I think two budget cycles ago. And is this the first step to getting on track with that? Or is this really trying to delineate the kinds of investments from all of the departments towards children and families?
I think Supervisor Arenas, it's certainly the latter, and it's really to, one of the missions, I think, of the Office of Children and Families Policy when it was created was to be able to with more clarity and depth, be able to describe the county's investments in children and families. And so the additional data collection is really an effort to be much more specific about what we're funding in terms of children and families, which communities we're funding, what funding sources, so that we can take that information and be more strategic in our planning. Hopefully that answers the question.
When we are talking about being strategic. One of the things that I know that our board is going to do is do some priority setting. Within that, we are also going to revisit what we established our last year's priorities to be, and to be more specific about what they are. I want to know, how are you creating that nexus, or how are the board's priorities driving what you pull out in terms of highlights?
Yeah, that's a great question. I think as we think about how we present the data back, we will have the 5 different board priorities as one of the kind of guiding principles, and one of those is certainly children and families. So, and then there's intersections, right, with things like housing and mental health. So what we'll do is we have the programmatic categories that follow kind of those lines of priorities. And this will allow us to look at kind of the investments in these different buckets to see how thoroughly we're funding with the existing county budget. So hopefully it was designed with an eye to align with the board priorities, and it will provide more depth and information, if that makes sense.
Yeah, that makes sense. I know that you're also looking for funding gaps and any overlapping contracts and services. I'm really interested in that. One, because I don't believe in that level of redundancy. And because we have CalAIM asking us to provide services differently, right? To be more coordinated in what we do. But there's also opportunities under CalAIM to draw down some federal funding if we're organized in a way that makes sense. And I'm just going to use one of the examples. There's one agency that provides, and I'm not picking on any one particular agency, but they provide assessments for children, and some of them are medically related. And I think that there is an opportunity for us to draw down some federal funding if that particular service was connected to the health and hospital. If they were connected to the health and hospital, then we could claim them within that realm and really expand what they provide. And yet we haven't, and we haven't done that kind of strategic placement of our services. I know that they've been, there's lots of programs that I hold dear and near to my heart, but we have come to a point where we're at $46 million deficit, and so we have to make sure that we are strategic. And overlapping contracts are something that I will be absolutely looking at. I know that we kind of ended that, we started that conversation back in December with a list of agencies and contracts, and I've asked for a more thorough listing that provides us with a better picture about what those really entail. And so I'm hoping that all of these conversations converge into this particular committee, so that we can take a look at what is it that we are actually providing, and what is the cost to our families for not being strategic and not leveraging other dollars that we could potentially leverage. So that is going to be my ask. I will ask for a motion to approve so that we can get this conversation going and move on to the next agenda item.
Supervisor, if you don't mind, I just wanted to add.
Sorry, who's? Oh,
I just wanted to add one thing and just appreciate your comments. I think that very much aligns with the direction that administration is giving to all of our departments on two fronts. One, to really make sure that we're putting services as based in contract in the right department, so that we're maximizing drawdowns of state and federal revenue. There's definitely a lot of services that departments through last budget, but I think there's a lot more opportunities unidentified yet to say, actually, we can draw down Medi-Cal revenue for these services if we locate them here and we do a better job of billing for them, thereby allowing us to use the same resources to deliver more services to more kids at the same general fund cost. That's very much consistent with direction we've been giving to departments, and hope that we will see a good number of those sorts of opportunities emerge through the budget process. But likewise, I do think in many instances, even our contractors would welcome certain opportunities where they're sort of being asked to deliver two small programs that look fairly similar for two different departments, and they could better utilize their staff and resources if we combine those into one single larger program. So we look forward to that, and it just so the board members are aware that's really consistent with direction we've been giving really over the last year to all of our departments. So thank you for that.
perfect. I really love that and appreciate that, Greta, because it is going to be more difficult, and I know that the way that we can draw down, we can definitely utilize whatever federal funding is still available to us, and we're going to have to be very creative about how we draw those monies, and we're going to have to become those experts, right, in doing so. And so I know that there's some. When I see money on the table that we've left behind, it really breaks my heart, because I know our families are really hurting, and like rental assistance is one of those potentials, and we haven't figured that piece out with CalAIM, and that is something that I'm really going to ask that we move on quickly, because it's just going to get harder. And I know I'm just preaching to the choir here, but my choir, let's sing the same song. For the sake of efficiency. All right, so we have a motion.
Yeah, I just want to add to that too. Sarah, I know we've talked about this before offline, other conversations, but the opportunity of drawing down funds in our hiring practices, being able to hire CalWorks clients and having the state reimburse us for half of their pay, or being able to braid our hiring practices with our policy practices through the CEFI, formerly FE program. Really would like to see those opportunities in whatever conversations that can lend to that space.
So I know we want to move on from this item, but there's a lot of great ideas and also things that we're kind of tracking and are definitely policy priorities. So certainly the hiring pathways, bringing in former foster youth and leveraging programs like CEFI. Supervisor Arenas, we're looking at ways to maximize CalAIM, and that's a conversation we're having in some of our cross-agency and partner meetings, including with the managed care plans and First Five, and knowing that their funding is being reduced. We want to really try to maximize potential funding. And then I also want to just flag your reference to the future report, I think, to this committee on the social services agency contract. So one of the reasons we chose social services as one of the pilots is because they've been doing a lot of work on looking really closely at the contracts and looking at providers that have contracts across multiple agencies, and how do we leverage those. So I'm really excited at the parallels between this process and the contracts review. And I know the contracts team at SSA is as well. So we're looking forward to coming back with more detailed information on those contracts because there are a lot within SSA, and they're really critical contracts, so we want to make sure that we're maximizing those.
Well, you just reminded me that we need to bring back this conversation. So I'm going to make a motion to return to CSFC with a report on those findings and what we discussed collectively from the pilot project to the March meeting, so we can have a continued conversation. And then we'll take a look at where social services contracts fit into the conversation. Listen, I'll stop there because I think that there's also an opportunity for us to take a look at maybe an off-agenda report for us to expand, but I know that you have your own pace and objective, and I want to make sure that you're successful in what we do. And so I will wait to hear back from March, and so we can really add to this conversation some depth. So if
Second.
awesome, alrighty. So Colin,
Vice Chairperson Young
Yes.
and Chairperson Arenas.
yes.
Motion carries. Thank you.
Wonderful. Okay, so thank you so much for the presentation. I appreciate it. We are now going to move into item number 5. This is our regular agenda, receiving a report from Social Services Agency relating to agreement with InPlay.
Good afternoon. George Montes from the Social Services Agency, Office of Contracts Management. It's my pleasure to be here to present. Congratulations to Supervisor Duong for her victory. And I'm here to present on the InPlay program report. I could give you a summary of an overview of the program, or we could jump into questions, whatever you prefer.
If you can give us a brief overview, that would be wonderful.
Oh my gosh. 1 second, I lost my glasses. Do you mind if I go back and see if I lost?
Go right ahead.
Yeah.
So this item is an item that I think was continually on consent. I pulled it out so we can decide whether this is something that we'd like to hear maybe on an annual basis, Vice Chair. I'm really interested in this item as there are a lot of questions about how do we let our folks, our families, know about a lot of the programs and services, not only that the county provides, but that our partners provide in our community. And having one place that is really convenient is what InPlay is offering. And so I just wanted to check in and then, of course, collectively figure out whether it's something that we need on an annual basis, and we'll put on consent. But for the moment, I'd love to hear just a brief overview.
Sure. Thank you so much. I did find my glasses. They fell underneath, so thank you for being patient with me. A quick overview really quickly. The program aims to promote student participation in after-school and summer programs, to promote InPlay's directory of after-school and summer programs to students of Santa Clara County. The vision of this program is to centralize resources that are beneficial to Santa Clara County families and simplify access and registration through an online process. There's a couple of highlights that I'd like to point out. One is this program was initiated in January of 2019, and we are in the 6th year of the program. The current contract is for $206,000 through June 2025. Incorporated in the program's functionality is a system called an Oscar system. The system is an innovative technology text-based registration system to allow families in the community to register easily through text messaging and responding through text messages. The program over the years continues to experience growth and interest. Currently, 65,967 users are active in the program. 704 providers are active in the program. 16,389 programs That is a 69% increase in programs and 140% increase in sessions. InPlay maintains 30 Santa Clara County school districts, which presents 98% of the Santa Clara County JK through 12th grade students. Flyers are created as outreach processes. They are shared among different forums in the community, within the county agencies, and the school districts. They are created in the county's threshold languages, which is Spanish, Vietnamese, and Mandarin Chinese. And that is my overview.
Thank you. I appreciate that. And so one of the reasons I wanted to pull it and just have a quick conversation about this is that I did look into the website and saw that I was looking at the south side, I was looking within my own district, and I did see our, I think the San Jose Public Library programs, but the San Jose Parks and Recreation, all of those classes were not listed, and so I wasn't sure if it was because they're fee related or simply because they are just missing. Can you answer that?
Sure, I could make an effort. I know that the registration process and the outreach and the marketing is done through an initiated process through InPlay program staff. So it might be that they just haven't linked those programs to the site. We can, if there's any inquiries anybody's interested in, we do have an open dialogue with InPlay to link them to those programs so they can reach out and possibly bring them in. I know that InPlay, at least in their discussions with us, have told us that they are very careful in attracting only vendors that they feel are safe for the community and are grounded and well-standing.
Great. Well, you know what? I think the City of San Jose's Parks and Rec Department has, they're legitimate. They're legitimate, and so I'd love to see those offered if you could provide that feedback. And talking about feedback, I'm also going to check in about our own public feedback with Colin to see if there's anybody that's waiting to give us some input.
There are no requests to speak.
Perfect. Okay. So we're just going to integrate our public comment, making sure we don't forget. Okay. So wonderful. I would love to see that that element contributed. And you know, we're doing a service for our families in terms of putting these programs together, but we're also in a way inadvertently subsidizing some of these programs that are fee-based, in terms of providing advertisement of a private business. How do we create balance with that?
I'm sorry, Supervisor Arenas, could you repeat that question? The balance of what?
So you have, there's some programs that you just finished telling us about that it is a one-click enrollment, right? When a parent goes in on their, respective parent portal, whatever it is, Parent Square, whatever that is, it's a one-click, right? So they're going to enroll in the activities or services or programs that they want their child to participate in. Some of those are private-based, correct?
Mm-hmm. Yes, they are.
Okay, and so are we charging those businesses any fees to be part of this InPlay, or are we inadvertently subsidizing advertisement for those folks?
Yes, thank you for that question. It is my understanding, though, that everything in the platform is free. It is through an engagement, and it is supported through our contract with InPlay to support those programs.
Okay, so I would like to see how we can explore either a fee that's involved, which is very minimal, but I think it creates skin in the game for some of those folks that are advertising through this free way of getting to parents and clients. We're always looking for revenue generating opportunities, and I think this is one of those, even if it is very minimal. I think, a low-cost fee, but if we have as many as you say we have, I think that creates something so that we can provide maybe a scholarship or some lowered fee within our own public library or whatever it is that we choose to do. And so I'm hoping that we can have a motion and have that integrated into the motion. But first I'll look to my vice chair for comments and questions.
Yeah, so point of clarification, Chairwoman Arenas, you're asking for a report back in terms of the feasibility of fees and what would be appropriate to be attached to this program?
Right, fees for those businesses that we're listing and providing to our parents, not to our parents, right, not to our public, but those businesses that are for profit, obviously not the ones that are government-based or not for profit, or that have any opportunity for fee reduction. I know like the city of San Jose or the city of Campbell, they have a ton of programs, and they are fee-based, but a lot of the times you can have a reduced fee if you apply. And so if it's a government sponsored, I think it's really different than when you have, those kids soccer agencies that are just purely profit. And don't provide any scholarships, and so I think there's a difference there. And I'll let the attorneys sort those bits out. But I think this is an opportunity for us to create at least a small fee for any of those agencies, because at this point we're advertising for them and we're creating a pool of customers. Yet, there isn't any fee for that service.
So yeah, for private profit generating fees, services and programming.
Right.
Yeah. I do have a couple questions to walk through, and then I'm happy to make the motion. So thank you, George, for this presentation and for managing this important program. It's really great to see this partnership going so well. And as a parent, I didn't start out at the county as a parent. I am a parent today. As a parent, I understand the need to find quality after school and summer programs. I also learned the hard way that you have to start signing them up in February for summertime. Missed that deadline once, never again. And I appreciate the relationships that we've built with our school districts and also with CAFPA. However, I really would love to know about the efforts currently underway or efforts that have been made to reach community organizations and neighborhood groups.
Sure. This is a question we've asked before for InPlay, and we've engaged through flyers, the network of CBOs that we have, to make sure that they are aware of this resource. We've also engaged every department, the social services agency, and other branches within the county to promote this program through presentations, flyers. The effort of reaching the community is made through different approaches. One is going directly to the organizations. The other one is using our partners within the county to promote this, and anybody else that wants to join. That stated, I know, and it feels like there's, even with the effort that is made, there's still opportunities to fill a few gaps.
Oh, of course, and the CSA Pore Collective and Somos Mayfair, including Somos Mayfair, and as well as ICANN, come to mind. Can you speak to, have we already reached out to these specific groups?
Yes, we have made efforts through our flyers. Sometimes our flyers don't always get to the right person, though. So if you want me to connect with them directly, I'm more than happy to do so.
That would be great. Thank you, George. And then also in terms of reaching out to our county, you referenced our county agencies. Really would love to make sure that the Vietnamese American Service Center is included on your list. It's become a great hub of community and family gathering for services and programming.
Absolutely. We'll make sure to follow through with that.
Now, going a little left here, a recurring theme you may hear here at the board and committee is our ongoing concerns of the incoming federal administration's new policies that would affect our immigrant populations, our immigrant communities. And, I may already know the answer to this question. I hope I'm correct. I don't want to assume, but our program provider is asking about the immigration status of the kids and the families that come to them for services.
It is our understanding that there are no questions or screening for immigration status is happening within this network of service providers.
Yeah, and then I would just make an additional request in this vein is that as we continue to develop our immigration response plan, recently there's been a lot of conversations about having more rapid response network trainings for teachers and at the principal level in our schools. So using that as an example, also what opportunities there are to communicate to guidance to these organizations that we're partnering with, that there is a heightened sense of concern and protection of our immigrant families and kids, and making sure that they have some type of guidance or understanding of the rapid response network of various resources, and also the county's policy of non-cooperation with ICE.
Yes, as for the social services agency, we haven't really sent out any formal direction yet to our community-based organizations. That doesn't mean that the county hasn't sent something out that I'm aware of, but we're more than happy to promote whatever the county's wishes are in terms of guidance and policy.
Yes.
Oh, thank you. I see that, Michaela, you're leaning in. I wonder if there's something that you wanted to provide.
I'm happy to hand it over to Greta.
We were probably leaning forward to say the same thing, Michaela, but I wanted to just make sure all the folks here, since I know we have some of our community-based organizations represented in the audience and others may be listening online, that we've been recently adding a lot of resources to the Office of Immigrant Relations webpage. We're asking that all departments in the county really share those same resources so that we have fully vetted, consistent resources going out wherever a person may go, looking at a county location or through a county program for resources, that they're getting the best, most up-to-date, and the same information on those fronts. So we'll just take this opportunity to lean in and say that, and also appreciate the suggestion that we make sure that all of our social services programs, particularly where we're working with families generally and specifically immigrant families, are making those resources available.
Yeah.
Michaela, did you want to add?
No, I was just going to make the same point as Greta, but thank you.
Perfect. Are you finished?
Yeah, I'd just like to make a motion. Actually, further discussion. I think this is a great presentation program that I would love to have to come back. I would love to have them come back on at least an annual basis before the summer starts. So around the January timeframe, so that we can prepare for the rollout of summer programming and summer signups.
Yeah, and actually, before you make a motion, I do think that, and I was just thinking about how logistically, obviously, we're representing different districts, but irregardless of whether I represent or you represent, there's ends of our the north part of our district is very separate from the south part of our district, and so I'm hoping that what we can see is what agencies are under the different districts and the different topics, so that we can make sure that there's a good cross-section of services, programs that are offered. Otherwise, I think the districts that are more resource available will have more notices, and because I'm a Alum Rock School District for one of my kids' parent, and I was trying to look because I know that there were in the report that I think it said it was 10 different opportunities to do that, and I was trying to look because I hadn't seen anything where we can just click and the registration form populates. But I know that there's an agreement with Alum Rock School District to do that. I guess I'm looking for equity, and I'm looking just to make sure that all of those resources are provided, and that maybe they're provided in a way that is a little more equity-based, rather than just whoever comes and whoever sees whoever sees or has the opportunity to see the flyers, because I'm telling you, probably our Alum Rock School District or some other agencies, well, not that one, because that one does have an agreement with us, but maybe others don't have the time to actually take a look at those flyers, and so I think that there needs to be a more proactive approach to integrate them into this listing, because in the end, we are paying for this service. So anyways, thank you,
you.
Vice Chair.
I'd like to make a motion to receive the report, with this report to come back annually to the CSFC in the January-February timeframe each year, with an additional request for an off-agenda report back as to the feasibility of assessing fees for profit-based private companies and organizations providing services on this platform, and also with an analysis through an equity lens of our outreach and engagement to ensure that our promotion reaches communities that are from socially disadvantaged and economically and also under-resourced communities. Is that okay?
Yeah, absolutely. We could do that.
Okay.
Perfect, thank you. Colin will help us end this one. Oh, and I will second that.
Vice Chairperson Young
Yes.
and Chairperson Arenas.
Yes,
Motion carries. Thank you.
perfect. Thank you so much for the report.
Thank you.
And George, if with the blessing of the chair, just real quick, I'll just ask that you time that annual report. I appreciated the direction to make it more comprehensive of all the programs that we have that are summer facing, that are school year facing, just to make sure that we're timing that report to have this CSFC discussion, also alert the community to application time periods and the like. So if there are some programs where we should come at a particular month to CSFC in order to alert the community in time for folks to apply, just make sure that's taken into consideration too.
That is wonderful. I love it. All right.
Absolutely.
Thank you. Thank you so much. We're going to move on to our next agenda item, which is agenda number 6. This is receive report from the Behavioral Health Services Department relating to School Link Services Initiative programs and projects. And as we have the exchange in chairs, I'd like to just welcome you once again.
Good afternoon, supervisors and committee members. My name is Zelia Faria Costa. I am the Director of the Children's Services over at the Behavioral Health Services Department. And with me today, I have Catherine Aspiris, who is our Division Director for School Link Services Initiatives and Programs, and also our helper here, who will run the PowerPoint. Thank you, Kati. So I'm going to turn it over to Catherine, who will do a brief presentation.
Good afternoon, Chairperson Arenas and Vice Chair Duong. My name is Catherine Spiris, Division Director with Behavioral Health. Our area of focus today is our FY25 Quarter 1 report. Next slide, please. We will focus on including the schooling services multi-tiered system of supports framework in our discussion. We'll talk about Quarter 1 school-based program updates, school-based behavioral health resources through wellness centers, and some of our next steps. Next slide, please. To ground us in our discussion today, we've shared this slide before, but schooling services programs have aligned with the programming with schools' multi-tiered system of supports framework with 3 tiers of support. Tier 1 is our universal supports and strategies, providing services to all students and their families. Tier 1 programs includes our family engagement program with 27 school districts that co-invest in 1 or more schooling services coordinators, as well as our prevention and early intervention program with county contracted providers. Services and activities in Tier 1 include mental health screening. We have psychoeducation, outreach, skills streaming, Triple P, which is a positive parenting program level 2, family engagement, and touch and referral case management. Tier 2 supports are more targeted and are supplemental supports to address risk. Our Tier 2 program is our prevention and early intervention program, again with our county contracted providers. And services include behavioral health support services in the classroom, skill streaming groups, parenting groups such as Triple P Level 3, Strengthening Families program, case management navigation, and some additional supports to teachers. Our Tier 3 services are for selected individuals who are needing support to remediate significant challenges, and those services are provided by our schooling services outpatient program and unconditional education program. These services include therapeutic services of individual, group, and family therapy, medication support, crisis intervention, and targeted case management. Next slide, please. In Q1 of the fiscal year 25, our family engagement program, which is now at 27 school districts, has served almost 2,500 students with referral and linkage to behavioral health services and other resources. Our schooling services coordinators have received so far a little over 2,800 referrals, in which 82% of them were successfully linked. Of the those that are not linked as of yet, 18%, those reasons included some had declined services. We also have services that our students are being referred to services and they're pending their intake. In the first quarter of the fiscal year, the SLS coordinators organized and facilitated 215 family engagement one-time workshops, and a lot of those were related to back-to-school information, psychoeducation. These events had in about 35,000 in attendance. Also in Q1, 20 workshop series were facilitated and organized by the SLS coordinator and over 2,000 attendees. The prevention and early intervention program had universal supports and strategies that have served almost 9,000 students and families. This included the skills streaming, parenting workshops, and psychoeducation. The prevention and early intervention, which is primarily the early intervention tier 2 supports, have served over 1,400 students with behavioral support services and almost 500 students with individual behavior services or group support. And then almost 500 students have been served with our outpatient programming in Q1. Next slide. To expand and improve school-based mental health services, we have 3 areas of focus: the development of school-based wellness centers, exploring and sustainability for school-based behavioral health services, and the expansion of services. The development of school-based wellness centers started off with our partnership with the County Office of Ed, in which Behavioral Health received a grant for the Mental Health Student Services Act in fiscal year 21. This allowed for a new partnership with the County Office of Ed to implement wellness centers on school campuses to increase mental health professionals and provide training to faculty as well as to wellness center staff. In following the Mental Health Student Services Act, the Student Behavioral Health Initiative program is part of the Children, Youth, and Behavioral Health Initiative, and this solidified a partnership between the Managed Care Plans and County Office of Ed, also with a partnership with Behavioral Health at the table. This implemented additional 6 wellness centers. And lastly, the County of Santa Clara has invested $12.1 million in school-based behavioral health wellness centers, supporting the implementation of new wellness centers, and enhancing existing wellness centers, and supporting the infrastructure. Thus far, we have 39 school projects that have included charter schools across 10 school districts. And since writing this legislative file and report, Behavioral Health has attended more than 10 grand openings of wellness centers in school districts such as Alum Rock Union School District, Downtown College Prep, Gilroy High, Sunrise Middle School Charter School. Next slide, please. The sustainability of school-based behavioral health services includes a new project for sustainability. In fall of 2024, Behavioral Health was awarded the Mental Health Student Services Act Round 4, Category 3, which is a sustainability project. This will allow Behavioral Health to support in preparation for all Santa Clara County school districts and the County Office of Ed to sustain wellness center services through the state fee schedule. The multi-payer schooling fee schedule it has started earlier in this year and last year. The fee schedule includes 10 local educational agencies within our county that is working to implement the fee schedule and start billing for services. In addition, Behavioral Health has continuous partnership with the school districts to explore sustainability opportunities, reviewing state grant opportunities, establishing new partnerships, and leveraging county resources, as well as maximizing county programs. Next slide. Service expansion. In fall of 2024, we were also awarded the Mental Health Student Services Act Round 4 grant for the Universal Screening Pilot. This grant will allow Behavioral Health to collaborate with other counties in the state to develop a statewide universal mental health screening roadmap. In addition, through this grant, Behavioral Health will pilot universal screening at critical transitional age stages of school grades, such as 3rd, 6th, and 9th grades. Additionally, in fiscal year 25, the schooling services coordinator and family engagement program was expanded to Sunnyvale Elementary School District, and they have implemented a schooling services coordinator. In addition, this past winter, they had started receiving services through our county contracted provider, Pacific Clinics. We have ongoing meetings with the school districts to look at emerging needs and interests of the co-investment and participation with behavioral health services. We have outlined and worked with the SLS coordinators to develop their outreach and activities for the spring of 2025 that will include areas specific to mental health awareness and suicide prevention, as well as Black History Month. And this concludes our presentation. We're happy to answer any questions you may have. Thank you.
Great, thank you so much. We're going to check in for community comments with Colin.
We have no request to speak.
Great. And I'm going to look to my vice chair to see for comments and questions. Go ahead.
Thank you. Thank you so much for the presentation. I just want to say I really appreciate the rollout of this initiative over the years, and that the three-tier system really tells me that there's thought and intentionality in how we approach our students' needs, and not just painting with a wide brush. I do have a point of a question to clarify. I don't know the answer to this, but I know that our schools have designated coordinators for the needs of our homeless students, and under the McKinney-Vento Act. I'm not sure how these services or the coordinator for homeless, unhousing, and secure students correlates or is connected to the schooling services coordinator and services.
Sure, thank you so much for your question. The Schooling Services Coordinator and the McKinney-Vento Liaison work partners and collaborate to send referrals to specific providers related to their specific referral needs. So in some cases, the SLS coordinator may receive a referral for an unhoused youth related to behavioral health services, while the McKinney-Vento Liaison may receive referrals related to transportation or education support. And in some cases, a handful of school districts, the SLS coordinator serves as a dual role, and they serve also as the McKinney-Vento liaison. So the centralized referrals for students who are unhoused, as well as for behavioral health supports or other resources, get all centralized with the SLS coordinator.
Oh, thank you. Yeah. I don't have any other questions.
Thank you.
Thank you. And thank you for that question, Vice Chair. I've actually been curious about that myself, and we understand that there's a lot of unhoused students, and we want to make sure that they have the support that they need, and it's something that we've asked our schooling services staff to keep an eye on. But even more than just an eye, really an integration of how do we provide services for those students, because being unhoused and being a young person is a formula for some social emotional needs, for sure. And so I do appreciate that there has been some discussions with the McKinney-Vento, but I think that there needs to be a really more direct partnership with those school districts that tend to continue to have a high unhoused number of youth, so that we can really tie in the county services, not just school link services, because I doubt that parents and students are really going to be interested in parenting groups when they are going to go back at the end of the day in a car to sleep, or whatever other accommodation that they are having. So I really would like for us to have a targeted plan with the unhoused youth, especially the ones in the zip codes that we all know, right? We recognize these zip codes. They're the same ones that have come up for the cost of violence. It's the same ones that the Latino Health Assessment is targeting. It's the same ones that the juvenile justice system receives referrals from. We know where we should target. And so I'd love to see I'd love to see an off-agenda report on that in particular. The other piece is, I recognize that this is lower numbers than in previous quarters, and I think the explanation is that it's because it's the beginning of the school year, right? If we know that there is going to be a slow to start beginning at the beginning of every school year, then I'd like to see what are those efforts that are taking place in lieu of. So are they ramping up? Are they connecting? Are the school districts connecting with our clubs in order to have more outreach, or have champions, or have more peer-to-peer counseling? I really want to know what is the lead up, because once they start having numbers, that means that that now the symptom is at a visual eye level, right? I know that we can't target this way, but I would like, and I don't know if you have your assessments or your questionnaires that when you figure out who's in tier 2 or in tier 3, of those youth, how many of those youth also have overlapping learning differences? Because I venture to think that if you have learning differences, there's social emotional issues, but there's also academic issues that we're not in charge of, but we certainly can advocate for. And I think when you have a combination of somebody, a kiddo who has learning differences, has social emotional issues, it's so easy to just set those kids aside and then offer, which is something that I have heard is that our high schools are doing, are offering the option of continuation schools. That basically is park over here because you are too difficult for us to support and address. And I have, this is not an option that I like for us to know about and not do something about. The other piece of it that is related to academics is that, and so this goes back to this collaborative that I've previously have asked for, because there's also other issues that the school district, and I'd love to see what kind of discussions we have around this, but there's a certain number of spots that are available for summer school so that kids can catch up, and if they fill up, you are out of luck. And now you're falling behind. Now the hope to graduate on time is slowly diminishing and going out the window. That creates stress. That creates a whole, just a whole domino effect that is related back to behavioral health. And I really want us to begin to poke at some of the school districts that, same zip codes for unhoused, so that we can see what is actually happening with the student body. Because we're only seeing what the school is telling us that they're doing, right? These are either fairs that they're providing, a group that they're providing, and this is a very small sliver of students, and I'm hoping that we can see a larger picture of what students are going through, even if it's not within the School Link Services realm or scope to do. And if it goes beyond our scope, then we need to make sure that we bring in those folks that make sense to bring in to address those issues. So, I'm going to turn to Greta and just ask, Greta, I'm asking for a more comprehensive service for our school link services, and I'm wondering, one, if you have an update on the county, city, school collaborative, because I think the issues that I'm talking about, I think would best be discussed at that level. But I also think that while we get there, because we haven't gotten there yet, we also have a responsibility to be comprehensive about the services that we need, especially like those kiddos. This is what our vice chair that began this discussion around the unhoused. If we know that there's kiddos that are unhoused, what is our level of responsibility to provide support services to those kiddos? Because schools, let's just acknowledge, they can't do everything, and they probably aren't.
Happy to provide you an update, and I'll actually defer to Sarah Duffy on that, who's working closely with behavioral health on the response that you requested on that. But before I turn it over to her, I just want to definitely agree with you that I think the issue you're naming, as I understand it, is really we have some extraordinarily high need kids in many of our schools, and often I think what we're all seeing is we have schools sort of sometimes doing well, sometimes doing poorly. Their piece of that puzzle, we sometimes will have a touch from behavioral health in that same school where they're interfacing with the same kid, and we know that if those challenges and supports aren't there early on, they're going to enter other parts of the county system. And so as I understand kind of the general observation you're making is where are our opportunities to better coordinate and to really do some of that deep upstream prevention through our work with schools, both holding them accountable for doing their piece and then holding well our piece. So just really want to affirm that I think we see that same need and opportunity. And I'll turn it over to Sarah to give you an update on how we've been thinking about and the status of that request.
I appreciate that. Thank you.
Thanks, Greta and Chair. So I've been working in partnership, and we've started initial conversations with behavioral health on working on an off-agenda report with some recommendations on what the collaborative could look like, and trying to think about how can we most effectively partner with the school districts where we see very high needs at this current point in time. And I certainly think the increased number of students experiencing homelessness is a top priority in the county right now. So what's part of the thinking that we're doing right now is how do we identify those schools? Who's the right person within the school districts and schools to be part of these conversations to make sure that it's kind of bi-directional information. We both know what the critical issues are in those schools, and we are able to share the county resources and even beyond county resources, some of the resources our partners offer, cities and other organizations, to help with what they're seeing. So we will be, I think, providing a report back in the next month or so, hopefully in the form of an off agenda with some recommendations on that. And the current thinking is that the Office of Children and Family Policy can lead the organization of that collaborative in partnership, not only with behavioral health, but other county departments that are working very deeply in schools. And certainly recognizing the role of the SLS coordinators, of course, is kind of one of the conduits of information, but just really having it be a kind of nimble group that can address the critical issues and try to make sure that everyone's aware of all of the resources that we have.
That is wonderful. Thank you so much. I know that you've made an effort to connect with me through my office, and I apologize if we haven't gotten to it. And so I'd love to make sure that we prioritize a meeting with you, as well as the discussion overall. I know that I'm asking for quite a lot, and that's because we have seen through the Latino Health Assessment some of those outcomes that we already knew about. We just anecdotally know about it. Collectively, we all understand who's failing, and I am asking for our systems to respond in a way that can really be, like Greta, you said, is more upstream, because we are waiting for children to fail in order for us to intervene. And that piece of it is unacceptable to me, especially when I see the faces of those children in juvenile hall, because those are children, regardless of the crimes they commit, and they all have a story of adverse childhood experiences that would make any one of us cry. And the opportunities given to them are very minimal, and so I want as many opportunities that we can create along their journey or along their path in order for them to turn it around, if you will. So anyways, I appreciate the conversation. Thank you so much, Sarah, for the update, and I look forward to having that conversation and that discussion. Okay, our Vice Chair, I think you might be ready for a motion.
Motion to receive report.
Perfect, thank you, and I'm going to second that.
Vice Chairperson Young.
Yeah. Yes.
And Chairperson Arenas.
Yes.
Motion carries. Thank you.
Wonderful. All right. Thank you so much for the report. We are going to move into item number 7. This is received biannual report from Social Services Agency, Department of Family and Children's Services, in the Office of County Counsel relating to the DFCS legal consultation policy for certain legal actions in child welfare cases. Now, I know that there's been some really good progress. I look forward to this presentation. And please welcome. Like I said, I know that there has been work on all sides to get this legal consultation policy where it's at now. It may not be perfect, but I think it's working, and I'd love to hear how, and if there's any adjustments that we need to make. Welcome, everyone.
Good afternoon, Supervisor Chair Arenas and Co-Chair Supervisor Duong. I'm going to go ahead and start us off on this. Wendy Kinnear with DFCS. I know that, as you stated, Supervisor Arenas, we had a formal presentation on this last time, so I'm not going to have a formal presentation today. However, I will give some brief highlights on where we are on this and entertain any questions. And then after I do that, I will turn things over to both County Counsel Michaela Lewis and Liz Morgan at the table, as well as welcome into conversation to answer questions both our Assistant Director with DFCS, Javier Guerrero, and our Interim Assistant Director, Melissa Suarez. So just some brief updates on where we are to date. As you so eloquently stated, this is connected to our corrective action plan and our efforts to make sure that really we have joint partnership with council to clarify for staff brief training and revised protocols on making sure that staff are supported at the supervisor and social worker level to be involved in legal consultations. As a result, we co-developed a training that was provided to staff. As of first part of December, we had 69% of our staff who had attended. I will note implications for the holidays, as well as staffing implications for areas that needed to attend really did impact some of their attendance. So we are circling back around with additional trainings in February, which is a lower volume month for us to be able to support our staff in attending that. And we'll be releasing this month a FAQ that directly responds to some of the questions that came up from those trainings for staff to clarify anything. And then future trainings will be included in our academy so that this is just part of the way we operate and the way we go forward within DFCS. I know that the other thing I would note is that there was concerns with staff with the signing that was needed with the word attestation on the top. And really the intention of that within the department was just to make sure that staff attended that training and that they understood this is our new policy. So we will be reworking that, and that will go out with staff as well. And with that, I will turn it over to Michaela Lewis and Liz Morgan for anything I might have missed, and we'll take questions.
I don't have too much more to add. I know with the additional trainings being scheduled, we're prioritizing that, and we'll be staffing them as soon as they're on the agenda. I'll turn it to my colleague Liz if she has anything to add.
Good afternoon. Sorry about that. Thank you. I don't have much to add, although I will say I do think that, and this is just anecdotal, that the efficiency of the staffings has been increased with the new process involving the social workers and the supervisors, and the initial communications and conversations has been really beneficial in assisting everyone to come to consensus and decision on what's best for the families. Having the benefit of the investigating social worker involved in that conversation from the very beginning has been really helpful. So I just want to make that comment, and I think the process is working pretty well at this point.
Perfect. Is there anything more to add to the presentation? If there isn't, that's okay. No. Okay, we're going to look for public comment.
We do have one request to speak online. Ben Z, you'll have 2 minutes to speak. The timer will start when you begin speaking.
Yes, Supervisor Arenas. I mean, you say everything's working, and I heard someone else just say everything is working. I mean, how can it be working if I'm here telling you that my kids are being sexually abused, and the county won't even give me a screening, give my kids a screening? A screening. I'm not asking for anything beyond a screening. I mean, like, you guys have heard that me say multiple times that, you know, that my son, he told me that my ex-wife was letting somebody rape him beginning at the age of 13, that there was unnecessary bathing with the children, adult with the children. There was sexual contact between two of the children. One of the children, on numerous occasions, rubbed his pelvic area against the rectum of another child, and I had to pull them apart. There's drastic changes in the children's personality at during that same time period that the sexual abuse was initiated. My daughter became withdrawn and anxious, and she stopped having friends, and my son became suicidal and strung out on drugs. I mean, like, you would think that the people who are here, who are hearing this, would be up in arms. Why isn't there a screening? But it's just, it's not happening. So how can it be working? Supervisor Arenas and then Supervisor Yun, I mean, you both say that you're parents. I mean, is this what you would want for your children, to not receive a screening after hearing these things? Please, I mean, we need to fix this. I mean, the people who do the screenings and start the legal process, they're here and they're hearing this and they're not doing anything. Please change this, Supervisor Arenas, please.
That concludes our request to speak.
Thank you. It is, I just want to remind our public that it's not customary for us to respond to public comment. And so we will continue our conversation. This is around the legal consultation policy for our DFCS, our Department of Family and Children's Services. And I'm going to look to my vice chair to see if she has questions or comments. Thank you.
Thank you, Chair. Thank you so much for the presentation and for this report. I know that this has been a tremendous amount of work by staff, by my colleague Supervisor Arenas and the prior Board of Supervisors. I want to thank you for listening to and incorporating the feedback from frontline staff and DFCS supervisors to create a process and training program that puts everyone on the same page. I recognize it's one piece of the ongoing work to improve our approach to keep children out of harm's way. One question I do have is what happens after March 2nd comes and goes, and there are still staff who haven't been trained? What are their options for completion?
An excellent question. I would say we will continue to circle back around until we have all staff trained. There could be a variety of reasons why they might not be trained by then. There's always staff out. There could be a leave. There could be new staff that are onboarded or come on or come back from leave. So we'll just have an ongoing process to wrap back around to ensure those that were out on leave and not able to attend, that they're circled back around.
I also want to add, part of the corrective action plan is really tracking the training attendance. So over the next year, we'll be regularly reporting to CDSS as well as at this committee, participation and attendance in those trainings. So the goal is really to get all of the active staff trained in the next month and a half. And for those, I think for new staff, they'll be trained through the academy, I believe. And then if there are those that are coming back from longer term leaves or other circumstances, we'll be tracking all of those. So we have a pretty solid tracking system in place that we've gotten together in the last couple of months. So I think we'll be in a good place to report on this as requested.
Thank you. So March 1st is a benchmark. It's a goal, a valiant goal, but that anyone who wants a training or needs a training will not go without a training option. Okay, thank you.
Thank you. I had similar questions in terms of the not yet attended, that 30% of social workers, and then 30% of the social worker supervisor. I understand that is a matter of time and scaffolding some of those trainings in order for folks to attend. We did have the holidays. And so keeping all that in mind, I guess what I'm trying to figure out is what in the interim are those folks who are not trained, what process are they utilizing in lieu of not knowing what the process is now?
Another good question, Supervisor Reyna. So we do have all of our managers trained, and so because managers are participating, it would be their responsibility to walk through that process and support a staff who had not been through that training or a supervisor. So it's still the same process. The process doesn't go away. It's just making sure that at the end of the day, as Sarah Duffy alluded to, we make sure all staff have been trained, have this policy, and then the circle back around with FAQs to make sure we've clarified anything that may not have been clear in training.
Got it. So you're saying they're following the process that is laid out now, because the managers at one point or another are going to get, because first it's the social worker going to the supervisor and then connecting with the manager, right? Then that goes up to the or towards the lawyers. But okay, so that's wonderful that the supervisors have the managers to fall back on, right? But who does the social worker have to fall back on if the supervisor doesn't know or isn't trained? Because the supervisor falls back on the manager. You see what I mean? You're following my logic. So what are those social workers doing? Are they just they heard about the process and they're going to follow it? Just give me a clue in terms of what they're doing.
It's a good question. My experience has been when we've looked at things is that there's just workers that haven't gone yet, or potentially supervisor who haven't gone yet. They're still following that process and they know it and they've received that. It's just they haven't gone through the formal process yet, and we have that tracking. Managers would be circling back around if there's no worker floundering, to my knowledge, not being able to follow process. We would make sure that they're shepherded along that process in what's needed on things. The other thing potentially, and I'll be really transparent about this, we think that word attestation was very put-offing to staff, and anticipate that there were staff who attended and just didn't sign that, and so we are also circling back around with that as well. So some of this, I anticipate our numbers to go up dramatically, and then with the additional trainings for us to hit pretty close to getting all staff by the end of February and March 1st.
Thank you, Wendy. I know trust is really important for that department, but that goes both ways, right? We expect to also receive that trust when we create those kind of bridges, and the flexibility for the trainings and the FAQ that you said you're going to release next month. I think that is all really good signs of due diligence and trying to make sure that this process works for everyone. I'm wondering if you could daylight some of the questions that were most prominent from the trainings, if maybe one or two things that you...
Liz, do you want to take that first from Council? Liz, I think you last sort of went through that FAQ. Do you want to take a first blush at that?
Sure. One of the questions had to do with documenting, or a few of the questions had to do with documenting the staffing in CWS CMS, because that's a new practice. that many counties in California have already implemented or been doing, but Santa Clara County has not previously been documenting its staffings. So there were a lot of questions in the training around that, which the program managers fielded and will be addressed in the FAQ, so folks will have the benefit of that in writing. It was also laid out pretty clearly in the PowerPoint where to put it in CWS, and so that was one question that came up quite a bit. There were also questions related to trying to remember now.
I can support Liz too. I know some of it was just more clarifying questions. What do we do if we can't get a hold of county council? So we had clarified the after hours number,
right.
the documentation on stuff, what happens if my manager or my supervisor is not available. So it was really more like operational type of things, just clarifying that information if it didn't come across clear in the training.
Oh, that's wonderful. So then it just allows you to work through some of that process.
Right, and will my request still be looked at if all my documents aren't attached, and that sort of, which the answer is yes, and you know, does the program manager still have to request, you know, the consultation? Yes. So we were able to answer most of the questions that came up in the trainings, but we ran out of time to answer all the questions, and so I do think that the FAQs, we're hoping that will be really a good resource for folks and something we can continue to add to also as questions come up.
Wonderful. That just is really important, right, to document and to make sure that we're transparent about what those answers are. I'm glad you were able to answer all of the questions with the time permitting. If you had more time, I'm sure you could have answered all of them. I'm really pleased to hear where we are with this legal consultation, because I knew from the very beginning this was something that it was just really important to all of our social workers and really important to the safety and well-being of our children. So I'm glad that we are moving through this and you are all exploring what is going to work for the staff. And I think writing it down and distributing is part of that. I really appreciate that. And so I'm going to turn to my vice chair to see if we have a motion.
Motion to receive report.
Wonderful, and I'm going to second that.
Vice Chairperson Young.
Yes.
And Chairperson Reyes.
Yes.
Motion carries. Thank you.
Thank you, and thank you for the presentation. Thank you for all the hard work that you've been doing. I know that you haven't come to committee to tell us about all of those really great things, but I just want to say thank you. Thank you. All right, we're going to move on to the next agenda item, which is 8, and this is a receive report from Social Services Agency, Department of Family and Children's Services, relating to the Child Welfare Corrective Action Plan and System Improvement Plan. So we have one new player to add to our presenting panel, and welcome.
Thank you.
Wonderful. Okay.
I can start us off really quickly. I'm not going to talk for very much time on this one. I've already talked quite a bit, but I just wanted to make sure that we do introductions, and I'll walk through the agenda very quickly on this. I think the plan was to go through item 7 rather quickly because we have a lot of slides on this one, and this one's pretty in depth. So again, I'm Sarah Duffy, SSA Deputy Director, joined here by Wendy Kinnear-Roush, who actually joined as the interim DFCS director on Tuesday. So this is her first week on the job. And then I also want to make sure that we introduce, and Wendy did this in the last item, but I'll just say it again. We want to welcome Melissa Suarez, who's agreed to be our interim assistant director of DFCS. So she's joining us, as well as Javier Guerrero, the other assistant director. So we're very grateful for their support during the transition. And then one of our main presenters today is Naveen Sangwan. She is a program manager that's been leading the work on the system improvement plan, and will walk us through the study session on that. So we have some slides here. Most of the presentation is number 1, which is aligning the system improvement plan, or SIP, and the corrective action plan, or CAP. So this is really a study session that we're doing today, and then this information will be shared with the board again at our quarterly update on February 4th. Then we'll go very briefly over the SIP approval process, and then we will provide the first of our corrective action plan updates. And this is an item that we will come back to CSFC monthly to present on and give you a status of where we are with the CAP. And so that is the plan for today. Naveen is going to take us through items 1 and 2, and then Wendy will take us through item 3.
Thank you, Sarah. Good afternoon, everyone. So I will be presenting to all of you the alignment of the System Improvement Plan and the Corrective Action Plan in instituting accountability and driving improvement in child welfare services and outcomes. At the same time, I would also be highlighting the key differences between the two. So the System Improvement Plan is a mandated operational agreement that each county has with California Department of Social Services. And this serves as a strategic roadmap to improve child welfare services and outcomes while instituting accountability. Now, this process is informed by California Assembly Bill AB 636, which was passed in 2001 and went into effect in 2004. This bill is also referred as the Child Welfare System Improvement and Accountability Act. So this bill actually mandated the creation of the California Child and Family Service Review process, and this entire process was modeled after the federal oversight process, which is referred as the Child and Family Service Review process. The goals of California review process and AB 636 are completely aligned with the national child welfare goals of safety, permanency, and well-being. The focus of safety goals is to ensure that every child is protected from abuse and neglect, and whenever possible and feasible, we are maintaining the kids safely in their home. The permanency goals emphasize in ensuring that there is stability in the living conditions of children, and we are doing our best to preserve continuity of family relationships and connections. The focus of the well-being goals is to make sure that we are enhancing a family's ability to take care of their children's needs, as well as we are catering to the educational, physical, and mental health needs of the children. Now, we measure the progress towards these goals by ongoing monitoring of 14 key performance areas. 7 of these performance areas are related to the outcomes of safety, permanency, and well-being. And there are 7 key systemic factors that we focus on. When we say systemic factor, it actually means factors that determine our capacity and capability to provide high-quality services. There are 7 of them, a few key ones being staff and provider training, having a quality assurance system, making sure there is recruitment and retention of staff, and so forth. The entire CFSR process has a 2-phase approach, which is repeated every 5 years. The first phase is the county self-assessment. Now, in this particular phase, we critically evaluate our programs, our services, our outcomes to identify what is working well and what needs further improvement. This is the stage where we are actively supposed to engage with all of our stakeholders so that we have their perspective and their voices also heard, and we collectively identify at least 2 to 3 core systemic issues. Once this phase is over, the second phase is the development of the system improvement plan. So in the system improvement plan, the first thing is we draft the goals, and these goals typically are connected to the systemic issues, and after that we come up with action steps and strategies by which we will address those systemic issues. And we are also expected to clearly outline as to how are we going to make sure that these strategies and actions are actually effective in achieving the goals or not. So all of that is typically outlined in the system improvement plan, and then it is implemented for 5 years and the cycle repeats itself. Now, the current timeline for the system improvement plan cycle, can we go to the next slide, please? Yeah. So we are currently covering the time frame from 2022 to 2027. Now, the first phase of county self-assessment, there was a delay in that due to the pandemic. Because of the pandemic, California Department of Social Services had to come up with new procedures so that we could transition from in-person county self-assessment to conducting it entirely virtually. This impacted not just Santa Clara County, but it impacted other counties in California also, and as a result, our county self-assessment was approved in May of 2023. This impacted and pushed the System Improvement Plan timeline. In addition, the board reforms, the recommendations and guidance from California Department of Social Services to focus on safety and continuous quality improvement, as well as their recommendation that we wait for their on-site findings report so that we can integrate their recommendations into the System Improvement Plan, pushed the System Improvement Plan to November of 2024. On November 1st, we submitted the System Improvement Plan implementation chart that outlines the goals and strategies, and this was informally approved by the California Department of Social Services. We are currently in January and in the phase of presenting the System Improvement Plan to our stakeholders, one of the presentations being right here. And our hope is to take the feedback, incorporate it, and then submit the final System Improvement Plan to the board for its approval. Now, while the System Improvement Plan is a mandated 5-year process, the corrective action plan is developed only when there is an audit, a review, or an adverse event identifies that there is a gap in compliance or performance. So the focus of a corrective action plan is to make sure we meet the compliance requirements as per the state regulations. And this, when we are trying to meet this compliance, we want to make sure that this is done in complete alignment with the System Improvement Plan. The state provides us with the technical assistance and also provides oversight and support. The progress towards a corrective action plan is tracked either monthly or quarterly, and we also submit an annual progress report. Now, while both the System Improvement Plan and Corrective Action Plan are aligned in instituting accountability and making sure we are in compliance and impacting services and outcomes in a positive way, there are a few key differences between the two, and I'll just highlight the few key ones. The first one being that the System Improvement Plan is about long-term sustainable improvement, and it is done over a course of 5 years, whereas a corrective action plan is about addressing time-sensitive, urgent needs and solutions that address the compliant issues, and this has a time frame only of 12 to 18 months. So in the corrective action plan, typically we will come up with some solutions, but then what we do is we take the solutions and embed that into the System Improvement Plan so that we are leveraging that and making it part of an ongoing process, and we are able to sustain that improvement. So that's how the corrective action plan can feed into the System Improvement Plan, and they both work in tandem together. The System Improvement Plan also focuses at a time only on 2 to 3 systemic issues. Now, coming to the manner in which we came up with the System Improvement Plan goals and strategies, this time we had a lot more comprehensive approach because it was not just limited to the county self-assessment, but we also took into consideration the guidance from the board reforms, the CDS's recommendations, especially the focus on safety and making sure we had instituted continuous quality improvement practices so that we are monitoring in real time whether our practices are effective or not, and we can course correct. So what we did was we actually did a deeper dive into our safety practices, and that helped us identify the 2 key opportunities for improvement. The first one being to improve our safety planning. Now, safety planning in the most simplistic way can be defined as a structured method that helps us answer the most challenging and fundamental question, that what needs to happen that will satisfy us and make sure that the child is going to be safe in their home. So this is the area where we identified opportunities to improve, and the other area where we felt we had opportunities to improve was the manner in which we were engaging with parents, especially the fathers. So those were the 2 areas which we identified. When we looked into our data, we actually wanted to see what are the challenges that these families are experiencing where children are experiencing repeat maltreatment. And we found that in 75% of the cases, the concerns and challenges were around substance use and mental health. And the populations that were disproportionately affected by repeat maltreatment were children 0 to 2 and the African American. We also took into consideration the findings from the CDS's on-site report, which revealed that there was a need to empower our staff and focus on making sure we are providing them the training, the coaching, and policy guidance that is going to build their self-efficacy in providing services and making an impact. So these insights then helped us identify 3 goals, which were crafted in partnership with California Department of Social Services. The first one being ensure safety of children by preventing recurrence of maltreatment. The second one is to make sure we are strengthening our quality assurance system. We have continuous quality improvement processes to monitor in real time and also to make sure we are taking stakeholder feedback and are responsive to the needs of the stakeholders. The third one is to strengthen the departmental workforce through making sure we are providing them with the training, the coaching, the policy guidance, especially focused on safety planning, parent engagement, building the social support, and so forth. There are 5 strategies that are aligned to each of these goals. The strategy 1, which pertains to ensuring the safety of children by increasing the utilization of the structured decision-making tools for safety and risk assessment so that we can develop robust safety plans and also make sure there is a support network. The second strategy is about making sure we are engaging with the families, especially fathers. We are focused on improving the quality of of social worker visits with the parents. The strategy 3 is about addressing the concerns and challenges that the caregivers are having with mental health and substance use issues. So our effort is going to be to make sure we are increasing the connection of the parents or caregivers to community-based mental health and substance use services. Strategy 4 is about continuous quality infrastructure capacity. We have developed various measures. We have developed various systems in place so that we can do ongoing monitoring and evaluation of the work that we are doing. Strategy 5th is, again, about workforce support and development. And already, like we've shared about the legal consultation training, there are other trainings for safety planning and so forth which are underway so that we can increase the confidence, the self-efficacy of the staff. Now, while we are working towards getting the system improvement plan approved and implemented, I do want to lift up that in September of 2025, we would also be initiating the pre-work for the next cycle of county self-assessment and system improvement plan, which is from 2027 to 2032. The state's expectation is that we are getting the next CSA approved in February of 2027. Now, typically, we would start the work 12 to 18 months before, but we have kept room for a little more pre-work so that we can integrate the learnings from the current SIP cycle. We can strengthen our partnership with the stakeholders and engage them in a much more robust fashion. So we would like to initiate in September of 2025. This will allow us to meet the timelines of county self-assessment being approved in February of 2027 and the system improvement plan approved in July so that the next cycle starts on time. And we can then get back to making sure that we are submitting our annual progress reports. Can we go to the next slide, please? Yeah. So this just talks about the annual progress report and getting back on track on the cycle. And this process would then repeat itself. I would also then briefly talk about the SIP approval process. Can we go to the next? And the next, yeah. So I'll just briefly talk about this. The approval process starts with the first is the county self-assessment has to be approved by the state. After that, we work in partnership with California Department of Social Services. There is a consultant who's designated to a county who works very closely with us. And then once the state pre-approves the system improvement plan, it is at that point that we share it with the board. and then we get the feedback from the board, we incorporate the feedback, we share it again with California Department of Social Services. With their input, we finalize it. We get the signatures from the local leaders like Child Welfare Director, Probation Director, and representative from Child Abuse Prevention Council, and from the Board of Supervisors. After that, we submit it to the board for the final approval, and once all of you approve it, we submit it to the state for their approval. And with that, that process ends, and we effectively start implementing it. And that is all in the study session. I will pass it back to Wendy. Thank you.
Thank you, Naveen. So I'm going to walk us through our Santa Clara County Corrective Action Plan. Next slide. As Naveen noted, a corrective action plan is triggered when a county fails to meet performance standards and requires specific areas to improve. A county must focus on immediate corrective actions to ensure compliance with all state regulations. DFCS entered into a corrective action plan with CDSS at the end of 2024. The slide that you're going to see walks us through some of those highlights for DFCS in the CAP. I'll note that all of the areas are focused on either safeguarding children, supporting workforce development, or key partnerships. Many of the deliverables for DFCS really focus on tracking and monitoring of child safety, which is our primary focus. This really is in partnership with our workforce, supervisors, and managers. For required tracking and monitoring, we are pleased to report that Santa Clara County continues to increase in compliance and exceeds state averages in both safety and risk completion, completion timely, and closure of referrals in 30 days. And we are working to increase further to get as close to 100% as possible. DFCS has rolled out required training for social workers, supervisors, and managers in the area of safety planning training and has trained over 60% of those required to attend. Makeup trainings are scheduled in the areas of January and February to ensure that all staff are trained. I would note here the same notation that I had around our legal consultation training. All of this hit around the same time for some staffing implications, and we're working through that. I would also note that DFCS is actively tracking all children requiring a safety plan, and in the January review of December safety plans for emergency response and voluntary cases, DFCS was at 100% of all children requiring a safety plan had a safety plan, and it was uploaded into the required statewide database system. DFCS is now working to ensure all technical details, including all required signatures, and then we will launch into our secondary phase, which is review tools by supervisors and managers, pulling random review of cases, and really doing that deeper dive on those safety plans. Next slide. In the areas of key partnerships, DFCS has been focused on training linked to engaging families and building strong networks for families. As we know, a safety plan is only going to be as good as the partnerships that we have with extended family and support systems and our partners. DFCS is training staff on family seeing, which is a holistic approach to engage families, shifting from a service-centered approach to a healing-centered approach, and engaging families to build strong networks that prioritize child safety. A 3-day training was provided in July and August. An additional session is underway this week, and we'll continue to roll out that required training. An additional training is on our ICPM with a focus on family engagement. This training focuses on teaming and engagement with our system and community partners to serve families in a holistic approach. This third training is being designed, and then a third training that we have was being designed with evident change and will launch in March. This again will also build on focusing on building a family's natural supports, repairing relationships, what's needed in order to rebuild a family's natural supports, and to identify other community supports that are in their network. Next slide. The third focused area for DFCS is really on supporting our workforce for all of DFCS staff. In the last couple months, this has included, as we just noted earlier, our new legal consultation process, ensuring all staff are trained on this process, ensuring social workers, supervisors, and managers are all included in the legal consultations. We have also launched listening sessions across all of DFCS with both DFCS and SSA leadership, focused on hearing from staff in all areas, really supporting and making sure we are keying in on worries, challenges, barriers, and opportunities that we have to improve. As of January 15th, we had 9 of those sessions held. We had a 10th session just this week, and we'll have 3 remaining sessions to complete meeting with all of the DFCS workforce. After all of the listening sessions, themes will be summarized and next steps to continue staff engagement to show that we're heard and to improve our areas of communication. In addition, focused training and support for staff regarding safety has become a primary focus, with surveys to gather feedback from staff and then ensuring follow-up afterwards. One example of that is feedback for staff wanted to have clear harm and danger statements. How do we document this? How do we do this? Upon hearing this, DFCS worked with Evident Change to develop follow-up training. This will be launched in February through April to support staff. And finally, DFCS and County Council are in full review of our policies and procedures to make sure they are clear and support staff's clinical work with families and assessments of abuse and neglect. Chapters that are currently under review right now and are prioritized include our Frontline Child Abuse and Neglect Center, investigations, and our practice resources, including SDM. I would end by noting that DFCS will be linking to the work plan that was developed from the board with recommendations from the SIP and the CAP, and we're in active process to do that. In addition, I would also note that our goal is to successfully meet all the requirements and to complete the CAP and have it set aside, and then to work on the goals for our longer-term planning and our system improvement plan. The ultimate goal is for us to get to a place where we have an internal CQI process that drives excellence in our work with children and families, keeping safety at the core in the work that we do. With that, we'll be happy to answer any questions.
Great, thank you. That was really intense and very helpful, because there's some things that allowed me to understand a little bit more as you reviewed those, Wendy. I'm going to look to my vice chair for comments and questions.
Yeah, thank you. Thank you for that very thorough presentation, comprehensive overview. So I just want to better understand and help me follow along. In the presentation, it appears that the current and next system improvement plan are going to overlap. Can you share how the 2 system improvement plans will work together, or how the current one informs the next 5-year plan?
Thank you. Sure. So typically in a system improvement plan, it's implemented for 5 years. So what happens is the county self-assessment for the next sub-cycle starts 12 to 18 months. And the reason for that is, by that time, if it's a typical cycle, you would have already implemented the strategies for at least 3.5 to 4 years. So now what you're doing is you are assessing the strategies to see what worked, what did not work, so you can keep continuity for the next sub-cycle. So that is why this process is laid out in this particular manner. But this has not been the typical cycle, because we are so late into it, like it's 3 years. But then we have an opportunity here that as we implement these processes, we are integrating the learnings, and we are building the strategic partnership and collaborative leadership, so that we can make sure that we are still doing the work in continuity with the next cycle. So we are not implementing or drafting the next system improvement plan till, I don't remember so it would be sometime in January of 2027 that we start working on the system improvement plan for the next cycle. What we are doing now is the county self-assessment, which would be approved in 2027. So we would be doing small research studies, because right now we are focusing on safety with recurrence of maltreatment. But we also want to make sure there is system independence. So the children who are being reunified with families, we would not want them to come back. And so we want to make sure we are tracking the other outcome measures to see what's happening there. So we would be doing intensive assessment and evaluation there. So all that work will be going in parallel as we are implementing everything that we need for this cycle. So there are 2 different things. You're implementing strategies, but then you're doing assessment of other areas also in partnership with stakeholders. So one of the things, feedback we have, is to build more collaborative leadership and engagement. So that's the piece we will be doing. And so both can be done in tandem. So once we are in January of 2027, we would be ready for our county self-assessment to be approved. And then is the time when we are working on the next, drafting the strategies for the next cycle. Does that help?
That helps, yeah. I think I'm going to have to keep on following along here to better understand. Really, what's important to me is this an opportunity where these SIPs overlap for us to be able to do some real-time responses and, implement, as we implement and have real-time responses, are we able to pivot as quickly as we need to address emerging issues?
Absolutely, Supervisor Duong. And I would just add on to that as well that it would be expected for any county in their SIP if they don't end up meeting all of those SIPs or learn things along the way that need to be continued or modified, that the self-assessment process, as Naveen is alluding to these studies and things going on, is our time to really collect what's working well, what's not, what still needs to keep working on. And so I would explain it as this. We didn't get as far along in our SIP as we would have wanted, and so we have opportunities. I would expect that many of our goals in our SIP will continue on to the other, but we'll have an opportunity to gather feedback in that self-assessment of what we're getting wins on and traction and where we still have work to do.
Thank you. Oh,
And if I can just clarify, once the next SIP is fully done, we'll transition fully to that SIP. So we wouldn't necessarily have two active SIPs going continuously.
thank you. And then when does the 2022-2027 SIP actually get implemented?
I'm sorry, I got so caught up into this mic. Can you repeat the question? I'm so sorry.
When does the 2022-2027 SIP get implemented?
So as soon as we've already initiated the implementation process, because there's a significant alignment with the corrective action plan, like everything that, whether it's a legal consultation training, the work we are trying to do in tracking our safety plans, the safety assessment. So all those strategies are already being implemented. So we have, because that is also aligned with the corrective action plan. Once the SIP is completely approved, we'll be in a position to completely implement everything, especially the continuous quality improvement, capacity building, and infrastructure. But other than that, the key strategies are already being implemented.
And when does the SIP get approved?
It's in your hands.
Oh, we receive report, we approve. Oh, okay, so it doesn't go to the state.
It does, but first you have, so that's what, the state pre-approves it, they have pre-approved, and then we are presenting to you. Once you give your feedback, we incorporate that.
You run
we
like
give
the
it
wind.
back to the state, and they say, great, and then we get everybody's signatures, we bring it back to you. So it would be great if, whatever you've heard resonates with you and it's approved so we can get started. Yeah.
Greta?
Naveen, I was going to just say, I've had some of these same questions. This is a very complicated process that I've learned involves a lot of, frankly, bouncing back and forth between the county and the state on these drafts. I don't know if you can pull back up the slide that has the set of lines and then arrows going down. That really puts the different steps in order. Might be helpful just to walk that through a little bit more slowly. I know you had a lot of content
process?
to cover. Yes.
Sure. Amber, can you pull the approval process, please? The control is with somebody else, so I think.
Looks like it's being pulled up right now. Just give it a second.
I don't think she's there because we had somebody online working on, oh yeah. Can you go to the approval process, please? That would be slide, no, I'll give you the slide number, sorry.
Slide 17.
Yeah. Yes, thank you. Yeah, this exactly is the process. So we already have the first step done, the county self-assessment, that's been approved. We then worked with the state to do the draft. Brian, your chat, yeah. So we did we got it pre-approved, that is the step 3, that's already been done. And then the step 4 is we are presenting here at the committee that we are at the step 4, and then we will get your feedback. And then we'll incorporate it. We will make sure the state is aware of it, and also probation, because we are working in tandem with probation. And then once the CDS is okays it, we will get everybody's signature. The child welfare director has to do it, chief probation officer, and the representative from CAPC, Child Abuse Prevention Council, and the board of supervisors have to sign it. that, once all of you sign it, we present it again to you for the final approval, and then it goes to the state for the final approval.
Thank you. So now I want to turn to the corrective action plan. So on page 20 of the plan, it's noted that a particular unit reported lower levels of confidence as compared to other groups in the structured decision-making tool post-training staff surveys, indicating a need for targeted support. What does targeted support look like in this instance?
May I? Or we have instituted actually a coaching model. So the thing I think which is really wonderful that I think DFCS is doing is having coaches. We have internal coaches and external coaches, because coaching is done at two levels. One is like, you could know everything, but you don't feel confident. Your self-efficacy is low. So we provide coaching for mindset, where we say, okay, what's going on here? What's coming in your way of doing what because we have very seasoned social workers. So that is the place where we are providing coaching to them. So whether it is because you are feeling low in confidence because you don't have that experience, or you feel that you need much more skill set, so targeted coaching is going to be provided. We meet them where they are and provide that coaching support, whether it's one-on-one or whether it's in group. So that's how we would be complementing training with coaching. So it's basically knowledge is necessary but not sufficient. So the coaching is going to take care of that sufficiency and provide that confidence.
Yeah, thank you. I appreciate that resource and support. Wendy, did you have something? No.
I think she hit it on. I think the other thing I would say in the targeted approach is we've been really mindful of any time we're doing training, feedback from that training of things that worked well or things that didn't land well, and we're making modifications to trainings in real time to clarify things. And then, as Naveen said, using that coaching time, we're also doing situations with different units, so supervisors and their teams going through, the plan is to go through real life cases to kind of talk about it so that we can have some group learning opportunities as well.
Yeah, thank you. That's very encouraging to hear, and I appreciate staff walking me through this process, not once but twice. Thank you. I'm done with my questions, Chair.
Thank you. It is a complicated process, so I don't blame you. One of the things that we did last year was we pulled together a lot of those stakeholders that you talked about throughout your presentation to hear from them what they believe some of the gaps in services were. We talked to families and we talked to stakeholders, whether they represented the children or the parents or the judges themselves. I mean, we just had a really good variety of folks who contributed. And one of those stakeholders were the foster care parents. And there's a lot of them that were very long-term foster care, and that some of them specialized, or at least their specialty that they felt was in, challenging youth per se, or medically fragile children. And one of the things that I'm wondering about, because what I see is in the breakdown of some of those strategies is missing is strengthening those pathways for foster care families. What is it that we're doing in order, I guess, where can I see that level of detail for the strengthening of foster care families? Or is that not in our vision for our long-term, our SIP? Or is that part of our corrective action plan?
I would say that is a little bit of a both-and situation. I would link directly to key partnerships. Obviously, our caregivers are part of our key partnership in really building out that network and making sure they feel a part of and have the supports and what they need to do that. So some of the corrective action plan is, are we doing that? How are we doing that? How are we making them a part of? The circle back around, I would say, is that we also know we have gaps in areas we can improve with our caregivers. So I know we are coming back to the board with our presentation on how to build out services for our more acute needs or higher needs youth and all of that. So some of the things we learn from the CAP and from the SIP will absolutely inform where we may have gaps and areas for improvement in our resources and support specifically for our caregivers.
Got it. Okay, so Thank you, and I'm going to look for that, and we can have an offline conversation about that. The other thing that we did was we had a whole work plan that I submitted along with Supervisor Chavez at that time, and then I followed up with a referral or a memo of recommended strategies based on those conversations that we had through this ad hoc committee, and we submitted that in November of last year. And so when you were developing your SIP goals, how did you incorporate what we, the board, has already approved and wants with what we are going to do systemically for the next, well, we're in the middle of it, so 3 years, 2.5 years.
I can speak to that, Supervisor. So I think through the development of the SIP, there was a very careful attention paid to what was going on with the board reforms and making sure that that was incorporated into the strategies in the SIP. With regard to the referral from November, that all of those items are captured in a document that will accompany the February 4th legislative file, which is a list of all of the board referrals. And we are going to actually crosswalk all of the corrective action plan activities onto that. And they don't directly align, but thematically they do. So for example, the legal consultation piece. There are board reforms. Some of them we've completed, some of those, and some we have, I think most of them we have, but we have these regular updates.
Right.
That is very thoroughly covered in the corrective action plan. So that's the first step. Once we have an approved system improvement plan, we'll do a like crosswalk with those strategies too, so that the goal is to have everything captured in one resource. So
I
the first step
appreciate
is the
that.
CAP, and then we'll do the SIP.
I completely appreciate that, and this is, you know, something that part of that referral I asked for the CAP to come in on a monthly basis before you submit it to the state, and because I want to avoid this. It's on page 8. And you don't have to. Well, you can go back to it if you want, but we have you know, that we have some approvals happening and going to the state without any notice to the board. And that is what I want to avoid, because we are that body that approves ultimately the SIP and that oversees the departments by overseeing our county executive. And we, as a body, we're working towards just reforming the child welfare system. And so I want to make sure that we are in lockstep in terms of approval process. And I will look to make sure that our CAP is coming in before and not after. And obviously SIP, we're in the middle of it. And the next conversation for SIP is, what do we carry on into the following SIP, because I know we're going to start 12 to 18 months before, which is kind of at the end of this year. Because systems don't change, you know, in 1 year or in 2. And so I'd love to have that conversation, and we can have that later on, but I just wanted just heads up on that piece. On the second, on the quality assurance, excuse me, on the quality assurance system item, how will we balance qualitative data with the quantitative, holding space for some of the feedback that we already heard, because I know it's difficult to gather folks once again and gather that feedback, because sometimes those are just themes. I would love to know, how will you look back or pull some of that information that has already been provided?
So we are focusing both on the quantitative. So we will be doing monthly monitoring where it's the quantitative, whether we are doing it or not. That's a simple part. For the qualitative, what we're doing is every quarter we will pull a random sample of, say, the safety plans that have been done, and we will do a quality audit. And that is where we get the data on whether we did a good job at it or not. The other piece, so this is the thing in real time, we can do that assessment to see what was the quality of our work. At the same time, we also have our case review team that does 25 reviews per quarter. And so what we do is we are looking at the safety items, and then, so when the case review is done, they write down the qualitative narrative. They give all the detailed information. So what we are doing is we are pulling that narrative and doing an analysis. We identify what are the themes that are coming up, so that when we are giving a feedback and we are trying to see, okay, what needs to improve, we have the data from the reviews that are done. We are doing the whole in research and evaluation, we just call it like a thematic analysis. We do some coding, and we identify, okay, this is what needs to be improved.
But those are with cases,
Yeah.
right? And I'm sorry, I got those wrong, and thank you for clarifying that. Because in the SIP goal number 2 is to strengthen the quality assurance system by continuously improving practice with the data-driven that you just explained and stakeholder feedback for the department to be responsive to the community and reduce recurrence. And so I get the case piece.
Got it.
So how are you going to create quality assurance with the feedback from stakeholders? How are you doing that? I know that there's and I have a suggestion, and that is the group that we suggested in our last referral, which is a body that could come together and provide, be a soundboard and provide that feedback. So I think that could be a possibility, because that's already a recommendation from the board for us to do that, which, by the way, I would love to hear an update on that. But I'll focus on the CAP and the SIP for the moment. Anyway, so that is what I was looking for, not the analysis that you're going to do on a case review.
Thank you. I misunderstood. So for that, there are 2 things we are doing to make sure we are responsive to the stakeholders. For being responsive, I'll start with the frontline staff. We will be having a CQI frontline advisory committee that will meet every quarter. So we will be rolling that out. Then for the stakeholders, that is a conversation we are having in terms of how can we have a CQI like a quarterly, like a CQI advisory committee where we can have stakeholders who can give us, with whom we can share on a quarterly basis what's going on with the SIP, and they can give us feedback also. So that is something those are the 2 things that we intend to do.
Thank you. That answers.
Supervisor, if I may. I know it's a little
I'm so sorry. I'm still not used to. Go right ahead, please.
Very quickly.
Jump in.
So we will be back on February 4th with an even longer presentation that includes an update on some recommendations or suggestions on the roundtable. So I think that'll be a very valuable potential resource. And we also have the CAPC as well. And we regularly present on DFCS updates there. So we have, those are just 2 existing stakeholder groups. And we also have, when we think about partnerships of agencies, which is also, I think, something we haven't talked about, but really critical, because we want to make sure we're partnering with behavioral health, with probation, with public health, with schools, of course, County Office of Ed. We have our inner leadership team as well, where we can certainly leverage that. That meets monthly, and we can use that as needed to bring back any updates with the SIP or have that kind of agency level thinking in one place. And that's a really powerful group because it's the leaders. So if there's something that's not working or we need more cross-agency collaboration, we can use that to really triage. So I just wanted to mention the roundtable, CAPC, and the inner leadership team as 3 really useful resources that I think we can leverage and report back on.
Thank you. And I would also include the Child Abuse Council, that I think is, it's on the agenda for later. Yeah.
And they're a required partner for us to have them involved.
Well, I love required anything. That's great. Okay, so the other thing that I was going to ask about for the SIP goal is that, it talks about departmental workforce through support and development of ongoing training. And so this is an issue that I brought up previously. I want to make sure that that applies to all levels. Right now, it makes me think that this is workforce, departmental workforce. I'm guessing that this includes management, or does this include, is this just the front facing and the social workers who actually, taking cases?
I can answer that question, Supervisor Arenas. I would say that our feedback in our listening sessions and seeing what's impacting everything is at every level within the organization. So obviously, we want to make sure frontline staff, and we have that feedback on what's happening, but we also understand the implications of all the system working. So a social worker needs a supportive supervisor that's coaching through that, and a manager, as well as all the way up to the exec level, and myself in supportive services. So I think we're looking at every level and how the system is operating and getting that feedback, and the listening sessions have been our opportunity to do that.
Thank you. If you have an acronym, please break it down for me so that I can. I'm not always good with acronyms. All right. The other piece that I wanted to get into is on page 9. You have a performance in achieving permanency with our 16, 17-year-olds, where it's only 4.5 of those youth achieve permanency in 12 months. And can you clarify if at this age kids can refuse placement and our services? And also, are we finding that we have less foster care homes that are equipped to support this age range? What is the solution for our teens?
Supervisor Arenas, I can take that one as well. And I would say some of this will be coming back in our joint response back to the board with behavioral health regarding our high acuity youth. My short answer would be a young person can refuse a placement because they have voice and choice and we can't lift them up and put them into a car. However, that is where engagement and incredible good social worker skills and working through that, what might be the worries or concerns behind that, to work through those things for placement. I would say that we have actively worked and have noted areas of improvement in caregivers needed for our most acute youth, and that will link back to that board item that's coming back and giving information of what that looks like and some suggestions.
Wonderful. I think that there it needs to, when you have any feedback, and I was trying to look where I wrote this down, but all of the strategies that you have for our children and our youth, obviously you know this, and thank you for saying that you're going to include behavioral health and probation if they are involved in those departments, or if they need to be involved in the behavioral health department, so that you're working collaboratively. I'd love to see the kind of strategies for the different age, the young, and there are already some policies that were addressed for our babies, and then our school age, and then of course our teens, our young adults. So I'd love to see the breakdown that way, so that I understand what strategies are working, and that we agree what strategies are working for the many different populations that we have, including I caught your reference to the dads, right? In understanding how you involve the dads, and seeing that as a way to be more successful, right, with the family. And so I appreciate that level of detail. Okay, I'm going to move on to our check-in about safety planning. I know this is a big thing. I heard you and saw that number of 98 cases that all of them 100% had a safety plan. But what is the time frame for those cases? Is that this last month? I mean, what was the time frame?
Good question. So right now, as Naveen noted, that is just a tracking on our safety plans. So safety plans would be a point-in-time pull. So that's a point-in-time pull of safety plans for December. A safety plan should not go longer than 30 days. That's the maximum for there to be review and monitoring and to decide, do we keep that safety plan in place? Do we modify it as such? Have we achieved safety and we no longer need that safety plan? Or is that a child safety plan not working, that child's not safe, and we need to have a more intensive intervention? Obviously, if something occurs and in the monitoring, that could occur sooner, but that 30-day mark is no later than 30 days. So that's a point in time. It's ebbing and flowing and changing. So at that pull at 98 days. So the tracking is we're pulling the safety plans. Do we have the safety plan? Do we have it? Then that deeper dive we need is to really do those reviews that Naveen was talking about. What is it looking like in monitoring? What's in that safety plan? Does it really achieve safety? And that deeper dive is where we're going next on that.
Thank you. Well, with keeping that in mind and that deeper dive, I know that I heard over and over the concern with the safety plan. Like you said, it just really is a changing document based on the safety and well-being of the child. And there are a couple of situations that would, and I wonder if there's any way that we can flag a safety plan when there's intimate partner violence, and maybe that partner is incarcerated but probably will not serve time, unfortunately. It's, a cycle that we all see. Or maybe it'll be a short period of time, and that safety plan then needs to get revisited because of that, right? We heard this over and over at the stakeholder. And then the other piece is, oh my gosh, I just lost my train of thought. I'll tell you later about the other occasion that we need to make sure that we red flag it. But if there's anything that we can do in order just to populate a check-in when there is a certain factor involved in their safety plan. So if it's intimate partner violence or whatever it is, where there's changing circumstances, or where there's maybe, this is where I was going to go, maybe where there's a parent that is incarcerated that will be released, and that could be another point. Is there something in our system that actually does that, or is that's just a human flag that needs to get raised?
Yes, I think there's a human aspect to that, and that's the need for us really to do those case reviews. An area of like intimate partner violence would be an example of that's the safety threat, right? The intimate partner violence is a safety threat we're trying to address. A good safety plan should really address those elements you're talking about. If we know one parent, the alleged perpetrator, has been incarcerated and we know they could be released, your safety plan should reflect checking back and having safeguards on what that timeline looks like for things. And so that's that review to really make sure, is the safety plan doing what's intended? Are there gaps, worries, concerns? And then feedback loops in real time to make sure we've got safety for kids, and then feedback loops to our workforce and our staff. What do we need to do to be able to strengthen those things, whether it's in coaching, training, whether it's in resources that are gaps and needs that are missing for families? All of that will be taken into consideration.
Wonderful. Well, when you do those case reviews, it would be wonderful if we could see maybe a category that has that in particular, and that it's evaluated that way, that when there is intimate partner violence, that you see under that quality assurance review, that there was an additional check-in or whatever that process looks like, but that it exists rather than it just lays dormant. There's another question I had about safe and safe with a plan. Can you, is it downgrading? Can you tell me the difference between those two?
That's an easy one. Thanks for asking an easy question. So there are 3 categories. Safe means we don't need a safety plan. There is not an active safety threat, and we don't need a safety plan. Safe with a plan means we have some type of active safety threat. Could be intimate partner violence, could be physical abuse, could be sexual abuse, could be general neglect of parents, alcohol or drug addiction or something of that sort. And then an unsafe is there is no safety plan to be put in place. That child cannot be in that home.
Oh, I see. Okay, got it. All right, and I know that I had brought this up and you touched on this a little bit, but that is the kids that we concluded inconclusive, and how are we checking back in with those kiddos? Especially if they were never within our system, there is no baseline really of whether how they either or in a difficult, more complicated place. How are you determining how they're faring?
So that's a great question, and that has and the concern, the limitation of this particular federal measure has been a concern. And so in order to put that checks and balances, we can track how many of those inconclusives are coming back as substantiated allegation. So when we track that, what we will be doing is we will do a deeper dive to see 2 of things can happen. One is that we need to do a much more robust job with assessment and how we did the substantiation. Either that is a CQI thing we have to do, or it could be that the circumstances changed. So it's a totally different situation, so it was outside our control. By doing that check and balances and tracking how these inconclusives are coming back, we can actually make sure that we are not, doing the substantiations correctly and appropriately, and we are monitoring that. So in the California Child Welfare Indicator Project, there is the data report where we can start monitoring that. So that's one other CQI thing we will be doing as we are tracking how many substantiated allegations are coming back and repeat abuse is happening. At the same time, as a parallel process, we will be seeing how many of those inconclusives are also coming back. So that's like the check and balance we can put. And if I may just add one more thing, is because I know a lot of our stakeholders have also asked as to why the inconclusives are more. And so I just want to say in 2012, the law was changed where earlier, even if there was a suspicion of abuse and it was inconclusive, you still had to report to the Child Abuse Central Index. But in 2012, that law said you didn't have to do that. And that impacted the rate of inconclusives all over California. So it's not limited to Santa Clara. And so this particular report will help us with that check and balance. Does that help?
I appreciate that, but we do have a narrative here in this county. We were the lowest we had the lowest removal rate. And that also goes back to the kind of legal consultation that we were having and determining that we couldn't remove a child, right? But that wasn't a clinical decision. And so what I'm looking for is also, what is that opportunity that we have with those inconclusive families to reach out, to provide any kind of offer in terms of services, or how are you doing? There is a level of responsibility for all of those inconclusives because they were determined differently than what we are determining now. And because of that, I think we have a level of responsibility and accountability to check in with those folks and to potentially provide some services. And so what are we doing around that?
A couple things I would say. I would say based on the feedback directly that we got around this, we are working with council to provide training to staff to really make sure we're clear about what falls into substantiated, inconclusive, and unfounded. So we really hold ourselves to what's needed on that and make sure we've got clarity across all of our workforce in that decision making. And then and then as Naveen noted, we are pulling those files for the inconclusive as well and kind of taking a look at what occurred for those families, how does that look, and learning anything from that. So we're working both in real time, what do we need to do right now, and then backwards, anything learning from where we were as well.
I appreciate that. And so I really don't want the narrative to change and for it to be this reference to the 2012 change. It was really because our system wasn't functioning the way that it should in order to keep children safe. And that's on us to do. And so at this point, I still am unclear in terms of how we are going to connect with those children and families that were deemed inconclusive. I understand that we are going to provide additional training to ensure that this doesn't repeat itself, but how are we going to connect with those kiddos because we're leaving them out? It's inconclusive. We don't know. So what are we doing in order to make sure that those kiddos, because we're just waiting for them to come back into the system is what we're doing.
I would answer this. I would say that just because there was an inconclusive didn't mean they didn't get services. So we're holding ourselves to that bar, but some of those families that were inconclusive could have still been served because there is a possibility to be able to serve them even with that inconclusive.
Well, would you, I'm sorry to interrupt you, but I think you make a really good point, Wendy. Could you please differentiate, and not now, but could you please, when you come back, differentiate between those that actually received services and those who didn't, and obviously they're all voluntary. And so I'm a safe guess that plenty of folks declined because life is life, and if you have multiple jobs and whatever those other factors that actually led them to us, or somebody decided to report them because of that. So I just want to, one, understand the difference, and two, have some level of action following those children and a follow-up to those children. And so call, a letter in the mail, how are you doing? Offering them a activity for the summer. There's a camp. We already have some of those services covered. If they, I think there's their local gym. We cover some of that membership, right? There has to be something that we offer those families in order to provide a level of just early intervention, if nothing else, because we are just waiting for them to return, is what we're doing. Okay, so those were my questions. I don't know that I have any more. I'm sure that once we bring this back with the rest of them, I'll have even more questions. Yeah, and I think there was one on the recurrence of maltreatment. And I forget what page this is on. Darn it. But the rate, the recurrence of maltreatment, it was going down. It was going from 1411 to 697. But when you look at the rate of recurrence of maltreatment, it's actually going up from 7.1% to 9%. And so, this is also telling us a story, and we should look at what that actually is entailed. And I know that kind of covers a little bit of the pandemic period, and I know that's that's creating probably a curveball for all of us in terms of reports and things that we normally would receive. But anyways, I just wanted to make a note of that. I will be looking at those rates in terms of how they improve or how they are not improving. My focus is also on the dually involved youth, because the dually involved program has very little, and when we very little participants. But when I asked previously, this was last year, when I asked about the number of children that were involved with our child welfare system, and then moved on to probation, or where I wasn't sure if there was happening at the same time. It was really high, and so we already know that this is absolutely high. We know the research shows that sexual assault, especially for girls, will lead to behavioral issues. And what I want to see is how we are coordinating among departments in order to build those dually involved programs in a way that is actually meaningful. Because I think it is for the very few that were involved, and I'd love to see how that could be expanded. Okay, so that's my feedback. I'd love to see if we could get a motion so we'll move forward from this item.
Motion to receive the report.
Wonderful, and I'll second that.
We do have a request to speak.
Oh my gosh, Colin. Yes, thank you. We can hold our vote, or Michaela, we can re-vote. Please,
speaker
Colin,
down.
thank you.
Next speaker is Ben Z. You'll have 2 minutes to speak. Timer will start when you begin speaking.
Yes, I really appreciate Supervisor Arenas' comments, especially pushing for answers when you have unfounded results. I have 2 comments. The first comment is feedback from stakeholders. I mean, I've been giving feedback for quite a long time now at countless meetings, by email. I mean, anybody listening to this would know with the things that I've reported, you would go in and you would do a screening. And you guys you're not doing it. And because there's a conflict of interest, and that should never prevent you guys from doing your jobs. The second thing is, you guys say that you engage with the families, right? Like, how many emails have I sent a lot of the people here? I mean, I've sent hundreds of emails, right? And the only thing that I got was, hey, if you want to file a complaint, go ahead and file a complaint. Or, I mean, I can't even get answers to basic questions like, has the screening been conducted? Do you intend on conducting a screening? What is the reason or rationale for conducting or not conducting a screening? And how do you mitigate conflicts of interest, right? These are basic questions that any parent making these kind of reports should get answers to. And I'm not getting these basic answers. I mean, you guys are, I'd have a higher probability of talking to the wall right now and getting an answer than emailing somebody from DFCS or social services. And there's at least 100 people on this email list that I'm currently sending out. I mean, these are things that you need to improve on. I mean, if you want to improve the outcomes for children being abused, I mean, you got to improve on these 2 things. Thank you for your time.
That concludes our request to speak.
Thank you. We're gonna, Michaela.
Oh, I just had the reminder about public comment, so we're all good
Yes.
from my end.
Yes, we can either, should we do a vote once again?
Yeah, I don't believe
Reconsider
you've
a
taken
vote?
the vote yet, so that sounds perfect.
Okay, so do I make a motion to reconsider the vote?
No, you haven't voted yet, so I think your motion is still active.
Oh, I thought we had.
Yeah.
Okay, wonderful. All right, so, great.
We have a motion, but we don't have a second yet. As
I
far
will
as know.
second that. I forgot about that.
Okay.
Thank you.
Vice Chairperson Young
Yes.
and Chairperson Arenas.
Yes.
Motion carries. Thank you.
Wonderful, thank you. All right, so we are going to move on to item number 9, and this is receiving the verbal report from the Office of District Attorney relating to the Child Abuse Prevention Council. I'm not sure if anybody from the DA's office is here. Kathleen, is that you? Oh, really? Welcome. I did not know that. Wonderful. Thank you so much. Thank you for your patience. As you know, as you heard, we had a bit of a study session in between some items.
Is this on now? Oh, great. Thank you. I'm Kathleen King, and I'm here from the Child Abuse Prevention Council, which is actually, this item is about the Child Abuse Prevention Council. And our chair, James Gibbons Shapiro, couldn't make it today, and he apologized and sent me in his place. We now have 20 members on the council, and we have 3 openings. And I'm here to give a very brief update on what we did last year and some plans we have for this year. So we did give out grants. The Child Abuse Prevention Council gets funds from the state and from fees related to birth certificates. None of it comes from the general fund. I'm sorry, I appreciate you having us speak, Chair and Vice Chair. Thank you.
Thank you.
Forgot to say that. And so our main use of the funds is to give grants to nonprofits working on addressing or preventing child abuse. And this year we gave to International Children Assistance Network, ICANN, Con Zion to Community, Rebecca Children's Service, Parents Helping Parents, Somos Mayfair, Bill Wilson Center, Catholic Charities, YWCA, and Pacific Clinics. We had a total grants award of $1.228 million. Some of the things we did this year, we restarted committees that were dormant since the pandemic started because of the restrictions on meeting, including our disproportionality committee, which held a training day for the Child Abuse Prevention Council on racial disproportionality in child protective services, and that occurred in September. We've also have 2 other areas we're really focused on, which is child abuse allegations in family court. We had a special meeting on that in December. Very, very interesting. And then we had one in January, a whole day talking about child homelessness. We also updated our website, and we have upcoming our symposium April 12th, and we're very excited that Chair Arenas, I believe, has agreed to speak at that. It's the 42nd symposium, and it was sold out last year. We have the symposium is invited 2 nationally recognized researchers from Washington University in St. Louis and UC Berkeley with different perspectives on these issues to prevent individually, and then to have a moderated conversation with each other about future policies and directions for child protective services. In addition, there is a full slate of speakers on sextortion and teenage boys, child abuse allegations in family court, and more. And if you were to ask, James had brought up the point that he's worried we don't have effective safety plans with follow-up in almost 50% of the cases. But Wendy, maybe he didn't understand the categories when he brought that up. I'm not sure. As we look to improvements in how we operate and work to prevent the recurrence of abuse and neglect, this seems to be a key area where significant swift improvement is both possible and achievable and vitally important. And that's my report. Thank you.
Thank you. We are going to go to public comment this time right away.
We have one request to speak. Ben Z, you'll have 2 minutes to speak. The timer will start when you begin speaking.
Yes, thank you so much for the presentation. I really did appreciate that the Child Abuse Prevention Council did a special meeting on family court. But really, I mean, like, I'm here having to resort to coming to a public meeting and say all these things that are happening to my kids, which is quite embarrassing, by the way. I mean, why do I need to do that? I mean, it seems to me that we're just, including the presentation before and the Child Abuse Prevention Councils, we're just doing a lot of talking and a lot of presenting. I mean, that's really what it boils down to. Let's talk and let's present and then talk some more. And then we've done our jobs. Because, I mean, like, you guys aren't actually doing anything. You're not taking the actions. I can't see it. I mean, if I have to come to this meeting and blurt out what's happening with my kids, and you guys still are just sitting there acting like nothing happened and nothing was said, and you go about your days and not answer any questions, not conducting any screenings. I mean, it's the status quo, really. I mean, for baby Phoenix and every other child that's been put into danger by DFCS. And that's really what we need to change. I mean, these talks and these presentations, they're great. They're great, don't get me wrong. But we need to move towards action. And I hope the Child Abuse Prevention Action Committee can start instituting the policies that actually make changes. And if I come to a meeting that you guys are stirred up, that nothing's happening, and you guys go to the Board of Supervisors and say, hey, how come his children aren't getting a screening? I mean, things of that nature. Anyways, thank you so much for your time.
That concludes our request to speak.
Thank you. I'm going to look to my vice chair and see if she has any comments or questions.
Thank you so much, Kathleen, and thank you to, please extend my appreciation to the members of the council for your work. I don't have any questions.
Thank you. I have a question about the 3 vacancies. Can you tell us a little bit more? Are they in any one of our districts?
That is a great question. I looked it up, but I don't think I had the correct information.
No.
I do know one's in Supervisor Ellenberg's, and she interviewed someone this week.
Oh, perfect.
So I do think we'll be at 21 by the February meeting. But I can find out where the 2 openings are.
Wonderful. I am looking forward to having our Child Abuse Prevention Council really cross over with our committee to inform us of the work that you're doing, but more importantly, to also give us feedback. As you heard, we are going through a very rigorous process for a corrective action plan, and then a system improvement plan. And this is the opportunity for the council to weigh in as well. And I think you heard Wendy talk about that earlier, and a couple of us did. So if you could please report back to the council, asking them to maybe take a look at our what we're calling CAP, which is the corrective action plan, and then our system improvement plan. For any feedback, we'd love to hear it. And I see you. Go ahead.
I
Go
would
right
say
ahead,
that
Greta.
James brought up about he's concerned about the percentage that do not have safety plans. So that was one feedback from the report.
And it certainly was true when the Department of Social Services at the state level looked at our Department of Family and Children's Services, and they did a bit of an audit and took a look at cases and found that 52% of them did not have safety plans. And so I know that was a focus for many of us up here as we were talking about the corrective action plan and the system improvement plan. And so that is definitely in our horizon, and our staff is actively pursuing that and correcting that, and not only that, but finding ways to implement quality assurance measures that will ensure that we continue to have safety plans in place for our children. And so that is definitely something that is a top of mind. So I appreciate that feedback from him.
I was just going to add, consistent with your comment, Supervisor, the recommendations that were being brought forward in response to your request related to creating that robust community feedback mechanism. One of them was really focusing on increasing engagement with the Child Abuse Prevention Council, making sure we have excellent members on the council. And so I know that we're planning to bring that back either to this committee in February or as part of the February report to the full board. because that got deferred given the length of this agenda. But we will also make sure to have handy information on which districts are responsible for appointing the positions that are vacant currently, so that we can also use it as an opportunity to highlight the opportunity for community members who may be interested in serving on that body and providing that expertise to come forward.
I love it. I love it. As you can see, there's plenty of transparency and opportunity to just participate with all of us and around this area. So I think this is really exciting, and I'm hoping that all of us, all these bodies that are coming together with our children and youth in mind, that we're going to make sure that all of what we do is the best the best way that we can support our children and families, and that we will create the kind of system changes that generations and generations will be able to benefit from. So anyways, I really appreciate the work that you're doing, Kathleen, and thank you so much for waiting. I apologize that we took a little long, but I certainly appreciate the feedback and the update, and we'll make sure we'll see you April 12th.
Well, thank you very much, and it's a great council, really well-balanced council, so thank you.
Perfect. Thank you. Okay, so I'm looking for, do we need, I don't think we need a vote because it's receiving a verbal report.
You don't. We've been doing them just as a matter of course, but you don't need to take one.
Okay, we'll skip today. Thanks. Thank you, Kathleen. All right, next is item number 10, and this is receive report from Santa Clara Valley Healthcare relating to updates from Sexual Assault Response Team Committee. Welcome, and thank you for your patience as well.
Good evening, supervisors. Good evening, board members. My name is Gigi Gill. I'm the nurse exec for Sexual Assault Safe Forensic Exam team at Santa Clara Valley Healthcare System. With me here is Anna Anton. She's the nurse manager for the SAFE program. Gretchen is here. She's going to help us with the slides.
Thank you. In your written report, you've received a summary of the activities of the 9 subcommittees that report back to the larger Sexual Assault Response Team Committee, as well as a brief summary of the dashboard and data system that we have implemented in the last year or so. So the PowerPoint here is really a reflection of some of that data that we have been able to start to collect. Some of the highlights are the community and partner outreach that we have done in the latter half of 2024. Namely, over 2,000 individuals reached across many different platforms, not including media events that we have also done. Next slide, please. Some of the main categories for these trainings have been law enforcement partners, high school, college, and university trainings, community outreach and advocacy events, and internal county partner trainings. Next slide, please. Within our data, this platform we use is used across many of the programs in the state, and the platform has said that our county reflects some of the cutting edge use of data in their system, and through it we have been able to identify key outliers, both to enhance our internal quality, where those were quality errors on our end, or identify true outliers who need particular attention and follow-up. Next slide, please. Some of the key data points that we'd like to share today are around sexual assault and IPV. In our data, 50% of sexual assaults with patients that we serve occur between the hours of 10 p.m. and 2 a.m. And then we typically see those patients about 8 to 12 hours after the fact. Last year, we had a total of 865 cases, with a vast majority of them having both law enforcement and advocacy involvement, with 92% law enforcement presence and nearly 95% advocacy involvement. Our average arrival time for our exam team was just over an hour. Next slide, please. Specific to intimate partner violence exams, again, most of these assaults happened in the evening hours, and then the data around their arrival time was a little bit more split between late morning and immediately following the assault in the middle of the night. Particular to our IPV data, we wanted to call attention to the fact that South County data here is inverse of what we see most of the time, and that is that over 60% of our forensic exams in Gilroy have been intimate partner violence cases, with only about 30% being sexual assault. Almost every other jurisdiction, those data points are flipped. And we are not sure yet if that is because of higher numbers of intimate partner violence or individuals not coming forward for sexual assault exams when they should be offered those exams. Next slide, please. This is just a breakdown of the types of exams that we do, still the vast majority being sexual assault exams. And then our final slide is a breakdown of which jurisdiction most of our cases fall into. Next slide, please. The vast majority are still occurring at Santa Clara Valley Medical Center, with about 10% happening at Stanford, 10% at Dominican, because we do service Santa Cruz County as well, and about 10% down in Gilroy. Next slide. Here you'll see our primary law enforcement partners. Definitely our biggest partnership is with, I think the data point there, we got skewed. That should be SJPD. Oh, sorry, SJPD is at the bottom. And then our second highest is Santa Clara Sheriff's Office. San Jose PD is so much higher volume that those numbers are listed on the bottom because they would drastically skew the graph. And I believe that concludes our data. And now I'll take questions.
Thank you. We're going to check in with our public and see what they have to say.
We have one request to speak. Ben Z, please accept the unmute. You'll have 2 minutes to speak. Timer will start when you begin speaking.
Yeah, I found it interesting from the data that a lot of people aren't coming forward and getting the treatment that's necessary, and treatment that the victims deserve. I think I have an idea that I'd like to shoot by Supervisor Arenas. I mean, the SART team is right here, right? And I've told you all the stuff about my kids. Perhaps we can take one victim off the board, or a few victims off the board, if maybe you offline could talk with the SART team and tell them about what's happening to my kids and ask them if they'd be willing to provide a screening for them. Because I know I've asked them before at a different meeting, I believe, I'm not 100% sure, but perhaps if it came from you, they'd be more willing, more open to conduct a screening for my kids. I mean, these are the people right here who conduct screenings after sexual assault. These are the people right here. Can you offline, I know you can't give me an answer here, but can you offline speak with them? And just tell them what's going on with my kids, see if they're willing to conduct a screening for them. I'd really greatly appreciate it. I know you have my contact information if you need to get a hold of me. But I mean, here, we can move past talking and we can take an actionable thing we could do right now. Anyways, I appreciate it. Thank you.
And that concludes our request to speak.
Thank you. I'm going to look to my vice chair, see for comments and questions.
Thank you, Supervisor Arenas. Thank you so much for your presentation and for the work that you do in this very difficult space. Ms. Anton, if you could just help me, I'd love to just hear more about the adult/adolescent sexual assault case type here on your slide. If you could just help me, just walk me through the separation of adult and adolescent and what implications that have brought.
Good question. So that particular verbiage is used by the state for the exam type that's done for anybody ages 12 and over. So it's the same type of exam format for that age range. Our program primarily services 18 and over, with referrals for ages 12 to 17 for a certain subset of adolescents from the medical clinic at the Children's Advocacy Center. So this data does not include all of the pediatric data that would be seen at the medical clinic at the Children's Advocacy Center.
Okay, and then amongst your patient population, which percentage of cases fall between the ages of 16 to 25?
Nearly 40%. And even further defining that, 1 in 5 is 21 to 25.
Mm-hmm. And has that resulted in more efforts or concerted efforts to reach out to conduct outreach at universities or spaces?
It has. This data is reflective of our work through the end of December, and already in the start of 2025, we have additional universities and colleges that we have outreached to and will continue to outreach to throughout the spring during Sexual Assault Awareness Month in April, and planning for the fall quarter and semester system.
Yeah, thank you so much for that, and I really appreciate your work. Thank you.
Thank you.
Thank you. It was not surprising to see that there was a higher number of South County because there was a report, and that they're younger. I'm not saying all of them but they probably could very well be, right? And Maria, do you remember at the JCC there was a study, a report that showed that there was more intimate partner violence in South County between young teens than in any other? I mean, there was no other part in the county that had those numbers. Do you recall that?
Yes, that was a report from essentially the 2022 Juvenile Probation Data Book that we later revised because it was a percentage. But it actually equated to only 4 youth who had been charged with domestic violence or intimate partner violence crimes in Gilroy.
Yeah, thank you. But there weren't any other youth in any other parts of the county?
That's not. We were talking about the top 5 offenses per zip code, so it didn't include if DV didn't rise to the level of the top 5.
Got it.
Yes.
Okay. Got it. Well, it is certainly something, a pattern to respond to, if nothing else, right? I just was surprised to see that it rose to that level of top 5. And unfortunately, we continue to see the cycle with the older or young adults, right? I know that you have subcommittees, and especially one in South County, so I would love to be part of that if there's any opportunity for myself or my office to participate, because this is, obviously the work that you're doing is very difficult, and trends are changing, but there is a pattern that repeats itself, right? I mean, this is a learned behavior, and I would love to participate to see how we can best support some of the areas that we see more incidents, or different kinds of incidents, or especially as our populations are younger. Thank you for the work that you're doing. Thank you so much for all that you're offering our survivors here. I'm sorry.
I was just going to say, it is called out in the report, so you may have seen that, but particularly because of the prevalence of IPV in South County that we have seen so far, our South County SART subcommittee is joined on a quarterly basis with the Family Justice Center committees that occur down in Morgan Hill to look holistically at both IPV and sexual assault.
Thank you. Yes, I did see that in the report, and I think that's very strategic on their part to do. The other question that I had was, how many of these were repeat offenses? In other words, that this was not their first assault?
I don't have that data on hand, but I do know we see that. I can think of cases off the top of my head where I know that that's the case. I don't have that data offhand.
Yeah, and the reason I ask is because there is, that correlation of if you were assaulted or sexually abused or molested when you were younger, the likelihood is that it will unfortunately repeat itself. And so I wanted to see what that looks like for our county, and hopefully provide some direction and data for us to understand further, to provide the right kind of strategies, right, upstream if we can. Okay. The last question that I have is about our IGR, our intergovernmental committee relations. I'm sorry, the relations team. Do they ever participate with the SART committee?
I don't believe they have.
Okay. Maybe that's also a really good way to kind of cross-pollinate the efforts that are being done. Okay. Thank you so much once again for the work that you're doing. It's I'm sure very difficult, and if there's trends that you want us, once again, thank you for highlighting the ones in South County that were definitely red flagged for me. I will make sure that I follow up offline with you. And I don't know if this report comes to the full board, does it?
I don't know that it's been forwarded to the full board. I'm sure we would be happy to present to the full board if the committee would like to refer this item to the full board for.
I would love to have a motion that refers this item to the full board so that our full board can hear it. Yeah.
Do you want me to make the motion?
Oh, I'll make that motion that I just said.
Second.
Wonderful. Okay. Thank you so much
Thank
for
you.
the work.
Thank
and
you for your
hopefully we'll
support.
see you soon.
Vice Chairperson Young,
Yes.
Chairperson Arenas.
Yes.
Motion carries. Thank you.
Thank you, Colin. Okay, so this is item number 11, and this is receive annual report from the Office of Immigrant Relations, Office of the County Executive, relating to fiscal year 2023 to 2024 activities. Welcome.
Good afternoon. Rosia Luna, Deputy County Executive, representing the Division of Equity and Social Justice. With me is the Office of Immigrant Relations amazing team. Shayla Peralta is in the back that will help us with a PowerPoint. Oh no, she's here, sorry, to my right. And Julie Ramirez, who is overseeing the Office of Immigrant Relations, and I'll just hand it over to her to go through our PowerPoint.
Thank you, Rocio. As you all know, the Office of Immigrant Relations supports the county mission by promoting immigrant integration and belonging, and also uplifting immigrant contributions and resources, and addressing the needs and issues of our immigrant communities. Next slide, Shayla. Next slide. So today I'll provide you an overview of the accomplishments for fiscal year 2024. Next, let's go ahead and keep it there. Let's go back, sorry. Those accomplishments included the release of a report that highlighted the economic contributions and demographic information of our immigrant communities. We also partnered with community organizations during FY24 to provide emergency response after the ending of Title 42. And we welcomed our 8th cohort of the New Americans Fellowship Program. Next slide. We collaborated with several partners on community events. We continued with our Immigrant Belonging Project, which is our needs assessment. And we administered, along with our partners at SSA, nearly $6 million in contracts for immigration legal support services. Next slide. Now I'll go into a little bit more detail of outcomes that you can refer to on the slides. Relating to the ending of Title 42, we helped co-develop a coordinated response with our community partners, and the county invested $710,000 in grant funding to our Rapid Response Network lead, which is Amigos de Guadalupe. In that time, they were able to serve 60 families, which consisted of 202 adults and 167 children. This effort also led to leveraging some funds from the city of San Jose. We continued those discussions during that time. They added an additional $150,000. And following the Office of Immigrant Relations partnered with the city of San Jose and a couple of other CBOs to provide an immigrant legal services clinic to ensure that the families were connected to the legal support services that they needed. Next slide. Related to our community engagement efforts, as I mentioned, we continued with our needs assessment, which we call the Immigrant Belonging Project. We completed phase 2 in last fiscal year, and in this time, we focused on community surveys in which we collected data directly from our immigrant communities related to the needs that they have and also barriers that they're experiencing in terms of accessing services. So we completed 2,881 surveys directly from our immigrant community as a result of our efforts with the staff directly and our partners. Next slide. And we hosted our 8th cohort of our New Americans Fellowship program, which consisted of 12 fellows. These fellows came from 7 different countries and spoke a variety of languages, in fact, over a dozen. Their culminating project focused on voting, getting the voter turnout, increasing the voter turnout within our younger voters, and they put together a fabulous public awareness campaign related to that. Next slide. For our contracts that we help administer along with SSA, you can see some of the outcomes here. Our contracts are divided into 4 categories, and we've literally served thousands of unduplicated clients through 16 vendors in the county. I'd like to draw your attention also to attachment B that outlines the CBOs that we partner with, gives you a description of their services, the dollar amount of their contract, and also their address. So you'll be able to see that we have community-based organizations throughout all of our districts, and these community-based organizations serve clients throughout Santa Clara County. Next slide. Of course, now that we are into the second Trump administration, our priority is focused on participating with the county response, leading some of those efforts, supporting others, as our county strategy is a comprehensive one. We will be finalizing the Immigrant Belonging Project and presenting a report in June of this year. We hope to host the 9 New Americans Fellowship cohort. And finally, I'm happy to announce that we will be completing the recruitment for a new OIR manager in a matter of weeks. So really excited about that, so we can have a full team here to serve our community and participate in our comprehensive response. Next slide. I'll leave you with a happy image, because in this time of just negative policies and the weight on our communities, I want to leave you with this image of our fellows who brought a lot of inspiration to our team and to the county. Thank you.
Thank you. Thank you for that presentation. I'm going to check in with Colin for our public comment.
There are no requests to speak.
Great, and I'm going to look to my vice chair.
Thank you so much for the report. I'm really excited to hear about the finalization of the recruitment process for our new OIR manager. Can you tell me more about what that means? Does that mean have we done the interviews and we have a finalist? And I'm seeing the nod, yes.
That's right. We've conducted 2 rounds of interviews, and now I'm ready to move on to the next phase.
Yeah, I'll wait until later I'll wait until the announcement of the new IR manager, since that you've already gone through the process. Just really curious about, and this could be talked about offline too, just really like what was the criteria, the selection criteria for this. I think, and during these uncertain times that there's just, this is a dream job, I feel, for those who are social justice oriented and rooted deeply in our immigrant communities. So very excited about that. I look forward to hearing more about who our new OIR manager is. I'd like to ask about our immigration legal services contracts and just what the plan is as the contracts come to, and I think they're scheduled to end this fiscal year, right?
Maybe I'll just quickly address that because it was part of the that process that would have kicked off a normal RFP was wrapped into the action that was brought before the board to allocate an additional $5 million towards preparing in a host of ways for what we assess as the initial impacts of the change in federal administration. And so we have already launched a very simplified process for both our current providers as well as any other interested providers to provide just those services, to identify themselves as either in a position to continue or expand their services, to propose other services that they may think are more responsive as they see needs in the community change. And so we gave sort of an initial submission deadline of that simplified form of the 24th, and then move on to the initial assessment of the inbound requests for extended or expanded service delivery. We've got a great team of folks who are going to be assessing those and then quickly rolling out to hopefully expand access to services, but also commit to continued provision of services through really all the appropriate and available providers for immigration legal services in the community.
Oh, thank you, Greta. Thank you for the very thoughtful approach as we continue to pivot to respond in real time. I know another executive order was signed yesterday, or just who knows how many more have been signed while we were sitting in this meeting, targeting our immigrant populations. I wanted to ask about the Immigrant Belonging Project, which I'm super excited about. I understand that the report out is going to be coming at the end of this fiscal year, so June 2025. How do you anticipate, or do you foresee any type of restructuring of our investments based on the Immigrant Belonging Project?
That's right. Because we're getting the insights directly from the community based on those barriers, but also some solutions, it may impact the way we deliver services. As Greta mentioned, the funding is done on a rolling basis, so while we're not releasing that RFP, we anticipate engaging with a similar process when it comes to the new allocation of funding that we'll get for next fiscal year, and we have that opportunity to redefine or add ways in which we believe will better serve the community based on the results of the project.
Mm-hmm. And then that augmentation or that reevaluation, will it extend beyond legal services, the provision of legal services?
It also includes the outreach and education that we have so far funded. Of course, we're based on the need, and then unfortunately a limited amount of resources. I can't predict exactly what it will entail. Our hope is that we can continue offering those various categories of service, including the legal services, but also outreach and education.
Yeah, and I would hope that there's some flexibility in terms of expanding into maybe new territory based on what we learned from the Immigrant Belonging Project.
That's a good point, yes.
Yeah, thank you. So last question is, I think it was San Mateo County that was designated a welcoming county. Not that we're ever in competition, but I mean, healthy competition. Are we designated a welcoming county? And beyond the tongue-in-cheek, healthy competition line here, it's, I think just any opportunity we have to communicate to the world and to our immigrant communities that these are our values. The fact that we've been participating in listening sessions, that people are still fearful, and there's still a baseline question of, do you care about us? Tells me that our messaging and the amount of work that we put in, the amount of work that you all put in, has still not landed completely in community. So another opportunity to be able to declare, express our values. Are we a designated welcoming county?
Unfortunately, Supervisor, we're not yet. There's still the opportunity to engage with that. We have done the first step, which was the report that I described at the top of our presentation, that demographic study, the one related to the contributions. It kind of was our initial step. I've had to put that on pause right now because of capacity issues, our shift to focus on the response. I hope to re-engage with that process and the organization that leads that process in the near future, but at the moment we're not designated as a welcoming community under those standards.
Thank you, Julie. I'm going to hang on to your words of not yet.
Yes.
And that I anticipate that we will have such a designation in the future. I can't imagine why we wouldn't, as the county that's done more than any other county on this front. So thank you for your work. That's it for my questions and comments today. I turn to you, Chair.
Thank you. So I'm looking at the status of immigrants and the top countries by origin, and India, Mexico, Vietnam, China, and Philippines are the top 5. Can you tell me if there's a difference in terms of if you've captured data that differentiates the type of status that people have, if they're visa holding, if they're undocumented? Obviously, you know, we want to be very sensitive about that, but I think there's a level of distinction that we need to make between the folks so that we can understand what kind of outreach, first of all, is effective with them, and the kind of strategies and services that are most appropriate.
Yeah, that type of data is really hard to capture. We've got some details in that report, and I can get back to you if I've got those details, Supervisor, but off the top of my head, I don't think that we do. I can look into it a little bit more, though.
Okay, thank you. I understand that the Title 42 was something that really caught everybody by, we had to deal with the consequences of that, and so I appreciate that you've been spending most of your time supporting our community that way. I'm wondering, from that support that you provided, what are the countries of origin that most populated needed support?
Our Latino communities have are the clients with that background receive the services and have really kind of dominated in the service delivery for our legal service providers. We do collect the data by background, and I can also provide you some more detail related to the activities for FY24 if you would like.
Yes, that would be really interesting to see what the different Latin American countries represented there. We saw folks coming in from other states because other states, designated us as a welcoming city and county. And so even if we don't have the status, and I know that his status is important, but I think people see us as such, right? And so we are those beacons. But I was really interested in learning what those countries were, and then what level of collaboration we had with their respective consulate offices. If you're prepared to speak about it now, I'd love to hear it, but if not, we can have a follow-up later.
Yeah, we've got relationships with the consulate office of the Mexican consulate, and also I believe it was from Venezuela. But our team is definitely in frequent conversation. They have requested trainings, as we've requested, had a lot of requests coming in. So those that see the activity from those countries, especially during the time in FY24 when we had a lot of asylum seekers and an increase in those populations,
Right.
Our communication with them was increasing. So we've got that connection.
Wonderful. And if you could reflect, and if there reflect the countries of origin that receive that support and the kind of relationship that was established with those consulates, that would be wonderful. Just to the last thing that I think I'm just wondering is, because of we don't know what's going to happen next. We can anticipate something, right? We are trying to be proactive by having more trainings in our community. I was just speaking with one of the school districts in South County earlier today, and they were asking me, we need more trainings. We have an agency in South County that provides legal services that is funded, and actually also funded through our grant, our district specific grant program. And I understand that there's not enough lawyers to go around, but our South County folks are really, there's a level of desperation. We had a listening session this weekend, and there were young people who showed up, spoke on behalf of their parents because their parents, just didn't have the courage to come. And there were some, not the courage, I'm sorry, that was really poorly chosen words, just are feeling that they can't take that risk to meet at places where it's been published that we are going to talk about this issue. So an assumption that lots of folks who are immigrants will show up, right? And mainly those who are undocumented. And so there's some who, some of the farm workers did show up. And one of the things that we noticed is that there is just fear all around, and when you have a little bit more information available to you, you're able to make more decisions, right? And then that level of control, or at least very limited, can also translate into less stress, and that less stress translates over to your children. And so all of this to say, one, I just wanted to relay some of that listening session information over to you. And the school district representative already has had a number of, know your rights informational sessions, but she wants to really inundate folks with information. If you didn't get it today, you can get it tomorrow, you can get it this way, you can get it all kinds of different ways. And so I'm wondering, how are we using the different ways, the different modalities that we have available to us, especially around the pandemic? We had an ability to send alerts, text alerts out, and wondering if that is another modality that we can use. It's not very expensive, and it covers a lot of folks. Especially for South County, because we have the last agricultural land. Obviously, we have a lot of farm workers. We have a lot of folks who are either documented or undocumented. We have a lot of visa holders, temporary visa holders, and I don't know that ICE is going to know or want to know the difference when they see folks. They'll just target our area. And so what I wanted to know is how can we augment the services that are going to go towards South County?
Yeah, I think we're developing a number of outreach strategies to both pass information along, utilizing schools, but also directly to business owners and families. We have external and internal strategies. Our external strategies primarily rely on the community-based organizations because they're the ones who have more trust with our immigrant families, and they do those workshops as you were referencing. We also are planning more outreach directly to businesses and to workers so that the businesses know their responsibilities and how to prepare for potential ICE raids, and so that the workers also know their rights. So those will come in a modality of a training. We're partnering with our Office of Labor Standards Enforcement to organize something in March that's at a broader sense. But really, our CBOs are on the ground now offering those information sessions and Know Your Rights workshops to families, businesses, and also parents through the schools. We're leveraging our school partnership as well. We're planning convening of administrators so that at that level they can get prepare for their individual schools, and working with county council on that. And then we have our immigration service coordinator who is doing, Teresa, who is doing trainings directly to schools. We've received many requests, but looking at a strategy that can be a little more far-reaching. So along with the individual request, developing a strategy that we can, where we can reach more families at once. So that's currently in development. Your suggestion of text is a good one, and can certainly pass that along to our CBOs to see if they implement that sort of strategy directly to their clients.
Yes, but I'm asking about our county service, our county doing something similar to that.
Because we don't work directly with the clients, I wouldn't have that type of database, for example, of the clients. And we rely on the CBOs to do that type of outreach directly to the families. We can develop something among our legal service providers. We're increasing our coordination with them, our information sharing with them, so that it is more streamlined. We're providing information on our website and pointing folks to the centralized hub of reliable information, but we don't have a mechanism currently in place that would provide the capability like a text that I'm aware of.
Okay, so I would ask you to do the training for employers that you're set to do in March. I mean, we need that tomorrow. It can't be March. There's already a lot of misinformation, and people are starting to, and I've already heard that they're getting charged, I think, like $900 for a power of attorney in case they're separated from their children, and you know that is not the right document that connects to that concern. But it is all convoluted, right? And people are going to lose a lot of money when they're desperate and they don't have the information. And so I'll direct it to you, Greta. I'll direct it to Dr. Luna. That the time is right, very now, and the schools have heard from. Some of our health centers, like Dolores Alvarado, was detailing what they're doing, which is, putting privacy signage in their lobby so that ICE can't go into that area. And, the school districts is also thinking, well, maybe we could do that for our lobby area. And so these are things that they're hoping they can do now so that they could then bring families in and have conversations and really hopefully address that stress that families are feeling, because eventually kids are not going to be sent to schools.
Yeah, I'll just add a little bit to what Julie mentioned, which is the Office of the County Council is providing pretty robust guidance to schools on a pro bono basis on a lot of those issues. We can get a little bit more information to the board offline on exactly what that includes and entails. And also for those school districts that don't immediately take advantage of the opportunity, connect with both of your offices, especially in some of the districts that we think are some of the most high need districts for that kind of support, to make sure that if the person needs to actually hear from a name they recognize and get a little extra boost to take advantage of that opportunity. But those initial opportunities are happening right now for exactly the reason you said, which is we know there's a lot of time sensitivity, and I think we've been lucky to not appear to be in at least these initial days of some of that activity, but we need to be ready and make sure folks are prepared. We're also looking in the review of proposals for additional services responsive to immediate community needs from some of our community legal service providers, also looking for what folks say they have the capacity to do in terms of offering a lot of these trainings, and then also really trying to channel everybody in the community who's, exactly to your point, trying to get folks the resources they may need to have their documents in order, to our OIR webpage, where, for example, on that issue, we have the Attorney General sort of put together a package of materials. We've also helped pull from different sources what we think are the best materials available, so folks don't have to pay money, especially not for inferior guidance and support, and can get that resource right free online through OIR, and that also our CBOs can direct folks to that resource as well.
Thank you. I appreciate that. That's something that I'm really worried about, because when we're stressed, we don't think clearly, and we make decisions that are out of desperation, and people are this is when fraudulent folks come in and take advantage of communities. And so anyways, I'm grateful to that. I think this particular district was connected already to our county council, but was not receiving the kind of detailed, I think, that level of detail where they wanted to know the difference between, can I put, privacy in the lobby area signage. I think that's what they're looking for in the moment. They've gone beyond, just some of the basics.
Yeah, and I think that question makes sense. I mean, I would have that question if I were leading a school, especially in light of the information we've all received in the last few days about the federal administration essentially threatening to go to schools and churches and other places that we've historically thought of as places where ICE activity would not be happening.
Right.
So I think we're going to continue to also need to make sure that as those natural different questions come up, that we have FAQs that are being refreshed, places that we can point to people that respond to the need in real time as it kind of changes what questions people have.
Yeah, absolutely. Michaela?
Oh, I was just going to mention too, if there's a question that needs support, if you want to forward that to me or loop us in, we can absolutely help with that.
Sure. There was information that Dolores Alvarado shared, and it was specific to clinics, but it gave other folks who were in there, who were service providers or superintendents, or gave them ideas in terms of what they could do. But I want to make sure that those ideas are valid and they can hold up. So anyways, I appreciate pivoting, and I will make sure to send them your way. And then, of course, thank you, Supervisor.
So to Julie and team and Michaela, coming out of some of the community listening sessions that we've had in the past couple of weeks, there was feedback given that a lot of the training that we've provided to the schools have been really targeted to superintendents, and that there is feedback from our teachers that they would also like to be included or to have training specifically for them. And follow-up questions indicated that the recommendation came that really focus on working with the principals of the school. They were called the heartbeat of a school. I thought that was really sweet how the teachers described their principal. But that would be potential pivot and strategy, where we're including both superintendents and focusing on the principals of the schools specifically. Another thing I wanted to just really reference is OLSC, the Office of Labor Standards Enforcement. So it's the engagement and outreach, the legal advice line that was set up so long ago, like 2019, was really structured in a time where we didn't have a Trump administration. We didn't have these attacks and assaults in the workplace on immigrants, targeting immigrants. And the investment then is more robust than the resources are allocated now. So I really want to point that out, and you're doing your work. I look forward to receiving the report back or report out on our plans to enhance and expand our services, and that'll be one place that I would pay close attention to, especially the legal advice line being, right now, or in its original formation, the legal advice line was for workplace violations, potential questions about pay stubs and wage theft, but now I would expect, just like during COVID, those questions pivoted to workplace violations and workplace safety related to COVID, that during this era it's going to pivot to what are my rights when ICE comes, what do I do as a business owner when if ICE were to come, what do I tell my employees? So I I know that our legal advice line are capable of answering all those questions. Will they have the capacity to be readily available to folks?
And I mean, I could just add that I think this is so rich and important. And to your point, Supervisor Arenas, when we're moving fast, we're doing what we think makes sense, but getting this real-time feedback of here's the point that needs support or here's the outreach is invaluable, and would welcome all of that to come, when it comes to you, comes to us, so we can start incorporating it.
Totally agree with that, and I would just appreciate Supervisor you mentioning the Office of Labor Standards Enforcement. One thing that I know is underway very much across the various offices in the Office of the County Executive is really trying to step back and think about how these offices can work in better coordination. There's so much overlap in the work that these offices can do, and we're really thinking a lot about also how we structure some of the teaming opportunities on a lot of this, such that, you know, even if a lot of the issues relate to immigrants' rights, where there's an employment nexus, we're pulling in OLSE so that it expands the staffing and the resources that we have. So more to come also on just how we're thinking about and trying to structure the work of the various teams within the Office of the County Executive to maximize the opportunity to really have robust staffing to be responsive to whatever are the issues of the day.
Of course.
Just on the texting idea, you know, I know texting can be expensive. Mass texting, but not to say that we do this, but you know, we do our OEM. We do have that emergency text system that goes to pretty much anyone that has a cell phone and a signal. And I know that we typically use that for emergency situations, but just wanted to highlight that as a potential resource, as a potential tool in our toolkit, should we rise to that level of emergency, right? If we need to alert folks, not to panic folks, but is that one vehicle that we can use? I just remember during COVID that we did use that to send out COVID reminders that, you know, not usually we use as for child abduction reports, right? Or missing silver alerts and purple alerts and all their alerts, but is this another potential resource?
Well, you know what? When we started getting more supervisor, it lessened like it wasn't like this huge thing, but it was more informative, and after a while it was like, oh, okay, well, it was normalized, right? Just getting these information bits from the county, because they are the ones best, the county that's overseeing our health and well-being. And so I think that and that is exactly the system I was talking about. I wasn't necessarily talking about us, you know, tapping into people's databases and sending them out, but rather us using the systems that are available, and not to alert and scare people, but I think it's, irregardless of whether you're documented or undocumented, or whether you are a supporter or non-supporter of the president, I think that information is very crucial, because then it could also clarify, hey, listen, even if this person is undocumented, they have rights. And, you know, you can't just report somebody because they're walking down the street and blah, blah, blah. I just think it could really benefit by establishing a culture of rights, really, of recognizing that people have rights irregardless of documentation. So anyways.
I'll just add, totally consistent with that. I just actually, while we've been sitting here, got a report that as we've been posting through the county's various social media platforms, information about everything that we've populated on the OIR website in terms of Know Your Rights materials. So that's one of the posts that's gotten the highest engagement ever. Wow. With some of the things that we've posted as a county. I think some of it, exactly as you said, with people who have varying viewpoints on some of this, some of these issues, but it does indicate at least that I think we're starting to be effective through multiple communication channels and really driving folks to that information platform, and so hope to continue to just really enrich the content there, and people know to go back as additional information and resources are added.
Thank you. Thank you. I really appreciate the conversation. See, you got us really going. Thank you for the work that you've already done, and look forward to the work that's coming. Thank you so much. And we can have a. We don't
I'd
need
like to
one,
make a
but-
motion to receive report.
And I'll second that. And Colin will
Vice
wrap us up.
Chairperson Young
Yes.
and Chairperson Arenas.
Yes.
Motion carries. Thank you.
Thank you so much. Lastly, we have, I know we're going a little later than we normally do, only because I think we had a special study session, if you will. The last piece that we'll do is hear from some key folks here on the dais, and this is item number 12, and this is consider recommendations relating to emerging issues impacting the county of Santa Clara, seniors and family programs and services. And so I'll begin with our director, Dan Little.
Hi, good afternoon, Vice Chair Jung and Chairperson Arenas. Daniel Little, Social Services Director. Just some quick updates. Our senior nutrition program is opening a new site for the Choosing Healthy Appetizing Meal Plan Solutions for Seniors, which is CHAMPS for short, on February 7th at the Jade Cafe in San Jose. CHAMPS is an innovative program designed to engage the younger old adults who generally don't associate themselves with senior centers. This provides them with an opportunity to socialize with other friends over a meal, just in a different setting. Recently, the California Department of Social Services recognized our county's Bringing Family Home program for innovation in using the structured decision-making tool and data to assess equity in enrolling and serving clients in that housing program. It has resulted in a greater alignment of practice and policies with program goals and addressing gaps in prevention and housing services. And then California has initiated a statewide CalWORKS Outcomes and Accountability Review to improve the efficiency and effectiveness of its CalWORKS program. And our very own Deb's CalWORKS program had no practice issues identified, and our progress report was recognized as an exceptional example, and it's going to actually be used as a statewide model for the template for the rest of the state. And then obviously we're going to continue to monitor any policy or executive orders that come out that impact our ability to serve our clients and provide updates to this board. So thank you.
Thank you. Next we have Sarah Duffy.
Thank you, Chair. So I just wanted to take this opportunity to share with the committee that the Office of Children and Families Policy, in partnership with First Five, recently completed 3 child care briefs for each of our 3 early learning workforce initiatives that are funded by the county. And I brought copies, which I can give to your staff after, but one is on the child care apprenticeship program. That brief highlights First Five's strategy to leverage early learning partners and stakeholders to support apprentices for center and family-based child care. Just a quick, some quick numbers on that. We've had 40 apprentices that have graduated in cohort 1 and earned associate teacher permit. And we have additional cohorts that are in the works now. So that's been a very successful program. We have the TK Teacher Equity Initiative that continues support of the early learning pipeline through a partnership between First Five and San Jose State University to run the first pre-kinder to 3rd grade credential program. Participants that complete the program are prepared for TK jobs in public elementary schools that offer higher wages and strong benefits. And a cohort is getting started this month. There's been some delays related to state credentialing. There will continue to be another group that starts during summer 2025. So we have a full cohort of 25 students, which is great. And then we have the Shared Services Alliance as a 3rd brief, and that's composed of family child care home leaders that are working on designing and building infrastructure recommendations to strengthen small business sustainability, improve quality, and share resources. So that brief shares successes of that work and examples of the different design ideas they have. So it's exciting work, and I'll make sure to give your staff copies of the brief, and they will be posted on the county website and First Five website as well.
Wonderful, thank you. And next we have Wendy. Can you hear? Oh, no, we don't. I'm so sorry. Yes.
Don Simone, Child Support Services.
Sorry.
That's okay.
Thank you.
I do have a little update on our budget situation.
How do you say your last name?
Simone.
Simone?
Yeah.
Oh, okay.
Coming into this current fiscal year, the State Department of Child Support Services incurred a $17 million budget as part of the larger state budget issues they were having. Our local portion of that $17 million was about $773,000. We were told that this would go for this current fiscal year and one more. And so recently we received our allocation notification for next fiscal year, which starts in July. And it is the same as it is this current year, so that's good news. The other thing that the state told us was that they are taking a wait-and-see outlook on the potential of a change or reduction in federal funding that may be coming down as a result of the new federal administration, and that if it does in fact come down at less, that we should expect further reductions. So we will keep folks posted as we go through the budget process, but we're keeping our fingers crossed. That's all.
We will all keep our fingers crossed, and that hopefully will make it rain with resources and funding. Okay, so thank you everyone for your time, for your patience. Hopefully what we do is next time we will be a lot more diligent in terms of time. But this time around we had a study session I think is time well spent. So thank you so much, and I am officially adjourning this meeting. Have a great rest of the afternoon.